And now something completely different.
Good afternoon. I'm speaking to you live just outside.
I like to think balding is just God's way of saying, now let's see you get laid.
Is it true that if you don't use it, you lose it?
What I'd really like to do is put the greatness of this man in perspective.
The hair loss community has a lot to be thankful for, having you as a spokesperson.
You mean you just call this guy up?
About life and about reality.
And now, America's #1 reality radio show for men. Live from Los Angeles, it's Spencer Kobren's The Bald Truth.
Hey guys, welcome to the show. 888-659-3727 is the toll-free number. Thank you so much for hanging out and tuning in. This is our Friday edition of The Bald Truth. And let me bring up Joe, by the way. Let's make that happen. I am Spencer Kobren. I'm the founder of the American Hair Loss Association, the author of The Bald Truth, The Truth About Women's Hair Loss, founder of a whole bunch of other organizations. I am a contributing editor to Consumer Digest magazine, WebMD, and a whole bunch of other, mainstream media outlets. That's great. I have the credentials, been doing this for a very long time. I am a hair loss sufferer, just like you guys. And if you are actually watching the broadcast and don't know, you're like, why are these two old dudes talking about hair loss when they have hair? I can tell you, at least from my side of things, this is a sham. What's going on here? I have been dealing with hair loss since the age of 21. I am soon to be 54 years old. I have been lucky enough to slow the progression and for a long time stop the progression of my hair loss using FDA-approved medication. But, there's a ton of hairspray. I paint the back of my head. I dummy this up, but I will say that I feel extremely grateful, extremely fortunate, excuse me, to be able to do what I do, to be able to have as much hair and have saved as much hair as I have without making some of the major missteps and mistakes that so many young hair loss sufferers do because they're misled, because they are provided hope against hope, because they are, sadly, while they think they're doing their due diligence, they don't necessarily have the wherewithal to make that happen because it's hard. It's really hard to do your research. Joe Tillman, on the other hand, who is the original hair transplant mentor, the guy on your left, he was like a lot of you guys back in the day. He just kind of took the word of the physician, and he jumped into surgery way before he was even a candidate for hair transplant surgery. And sadly, back when he had it done, it was the dark ages, pretty much, and he ended up with some really bad plug work, which, luckily has been corrected. But this guy's been through it all. So listen, we're here to guide you in the safest possible direction when it comes to anything and everything hair loss. We were not here to sell you anything, which is a surprise for a lot of people. They figure we have to be selling something, but we are not. And the truth is, maybe if we were selling something and we were adding a lot of clickbait to what we're doing, maybe it would make it easier for you guys to find us as opposed to clicking on all the bullshit that's on YouTube, sadly, and being misinformed, being misled, being provided with, maybe, partially legitimate information that has just been kind of regurgitated from stuff that's been read online from guys who have actually never been in the trenches, never been in this field, really don't know what's happening behind the scenes, do not know where all the bodies are buried like we do. And unfortunately, I hate to say it, but we do. And there's a lot of bodies that's been buried, so to speak. A lot of shit that goes on the down low that you guys have no clue about. And we try our best to help you avoid all that shit. Right, Joe?
We do, but I want to make sure, like, a lot of people may not even understand what we're saying when we know where all the bodies are buried. it's kind of an old school type of what how do you describe that? Not even just an old saying that means that we know a lot of background information on a lot of the clinics that are operating. We know about not all, but a lot of the bad cases that clinics don't want you to know about. We know about how a lot of these doctors that are operating today on patients just like you every day are drug addicts, have criminal histories, criminal records.
They are
really bizarre individuals.
They've abused their wives. They've been, domestic violence. They have, they're sitting in the rooms across the country of Alcoholics Anonymous. I mean, the shit that we know. And listen, there's nothing wrong with getting sober. That's great. Everyone makes mistakes, and everyone is prone to addiction and all that stuff. But we know just about everything there is to know about most of the physicians and a lot of the technicians, believe it or not, who are in this field. And the problem that we have is we have to work within the parameters that is this industry. And it is our job, listen, you guys are going to have surgery. You guys are going to see the ads. It is our job to try to guide you in the safest possible direction. But with that said, there's plenty of great guys who have tremendous, long-standing, really good reputations in the field who fucked people up, or who have patients who believe they've been fucked up, or who have had problems in their past lives, whether they are DUIs or whether they are, just being addicted to drugs, or whether they, this is the nature of the game. So what do we have to work with? We have to do our best to try to provide you with as much insight and information. And when we talk about certain doctors, and we talk about, obviously, the IAHRS, we are working with the best who are in this field. And we are talking about human beings who have faults and who have failings, who have made mistakes. And frankly, like I said, your short list consists of doctors who all have some form or another, depending on how you look at things, skeletons in their closets. Maybe unwittingly, accidentally, whatever. It's the nature of medicine, it's the nature of cosmetic surgery, and is certainly the nature of this field. And it's important that you guys know that it is not atypical for this particular field. This goes across the board in medicine. So if you guys think that just because someone has a degree and is wearing a white coat and may actually have a good reputation, that they are perfect, A, don't have a hair transplant, and B, you guys are fucking fooling yourselves.
Well said. And I thought it was important to kind of expound on what that actually means, because we say, you say it every week, and it kind of hit me. It's like a lot of people might not fully understand what that means, especially if, with our growing international audience where English might not be the first language. So I thought it was important to kind of expound upon that. So well done.
Sadly, I think we have some listeners who were born in the States, and it doesn't seem like English is their first language.
Well, that could be the case. I did see that in the chat room. We got someone listening from Croatia, so thank you for tuning in. We appreciate that.
Awesome.
I've always wanted to go to Croatia. It's right across from Italy. It's supposed to be gorgeous.
All right, so we wanted to talk about a lot of the stuff that's going on online. And guys, the phone number, if you don't call in, we don't continue the broadcast. 888-659-3727. That's 888-659-3727.
We'd love to hear from the guy in Croatia. Give us a call.
Absolutely. There is a tremendous amount of clickbait that's out there online. There's a lot of guys who are doing videos or who are out there just, trying off-market, gray market things, who are doing whatever they can to kind of avoid what we know works, or they've had unfortunate side effects from trying to use FDA-approved medication, and they are hoping against hope or doing whatever they can to try to prevent or treat their hair loss. And sadly, a lot of people are kind of going to YouTube or other online resources to get this information, and they kind of latch on and kind of listen to this shit like it's the gospel. And in general, most of the information that's out there is being provided, like I said, by people who really don't necessarily understand the science. They read the science, they regurgitate the science, and then they try to apply that science. We call it, and we've been calling this forever, starting back in the old forum days, bro science. It's a pretty popular term now.
Yeah.
But if you look at the old school message forums and even ours now, I mean, you will see a tremendous amount of bro science on there. People who kind of, and it's translated into the new world of social media, relatively new world. For years, there were the guys, the kings of the forums, the guys who everyone looked up to. All the sad sacks, all of the vulnerable hair loss sufferers looked up to and hung on their every word. It started with a guy back on alt.baldspot that then went over to the other bigger forums, and he was known as the science guy who knew everything about everything when it came to finasteride, all the drugs, all of the the possible ganoids. What is it when it affects your balls? Anyway,
say it again. What?
Gonadal? Yeah, gonadal issues.
Gonadial.
Gonadial issues. Yeah, whatever. And it sounds all, I mean, really sounds like, wow, this fucking guy knows what he's doing. He may be a biology major. Or he could be a janitor sitting in his underwear who has, just decided to take on this role. As we all do in life, we want to feel somehow relevant and important. And a lot of guys have utilized these forums and leveraged these forums, not to harm people, but, for their own, self-esteem boost. And a lot of guys have been led down the wrong path. A big issue that we are seeing, or a big topic that we see talked about all the time now, is derma rolling and how it affects hair loss and hair growth. I have my opinion based on being in this industry for years, but Joe actually tried it himself, and I'm going to let him, talk about it. And really, it's time that you guys get the truth when it comes to derma rolling and hair loss.
Well, derma rolling, it's not really a new concept. I think it's probably newer to hair in the past few years, but I've got my own right here. It comes in one of these packages here. Usually there's different versions. Some people think that derma stamps or derm stamps is better. I've got the roller. I like it. I mean, if I was to use one or the other, I don't think I'd have really any sort of preference. Sorry, I got a phone call coming in. Cancel that. But this is what it looks like. You'll see them online everywhere. See if I can get a close up on that. Don't know if it's going to focus. But it is literally a roller with really tiny needles. This is, I think, a 1/2 mil. Actually, it says, hold on a second, I'll tell you exactly what it is. Yeah, 1/2 millimeter. And I think that's pretty much the ideal length that everyone recommends. And the idea behind this is that when you use a derma roller or a derma stamp, what you're doing is you're sticking these needles into your scalp to create micro wounding. And the theory behind micro wounding is if you look at facial issues, it helps to get rid of fine lines and scarring from acne or things like this, because it creates an environment where new tissue, new collagen is created. And it is effective. I mean, there's no doubt about it. It is effective. But when it comes to hair loss, the idea and the observation is that this regenerative process also induces weaker hairs to thicken, or for more specifically, the anagen phase become a stronger anagen phase, as opposed to without this micro wounding. And what you'll see online when you're doing your research, when you go on Google or Bing or whatever, you type in derma rolling or derma roller or micro needling, that's another way to refer to it. You'll see a lot of people talking about this, and you'll see before and after photos, or you'll see how-to videos or whatever. It's not rocket science. You take the roller, you roll it on a specific area that you want to deal with, and eventually you might see some sort of difference. Here's the problem with this. It hurts like a motherfucker. These do not feel good. And if you're one of those people that's thinking, well, I can just put some sort of topical anesthetic on my scalp to numb the pain or to deaden it, it's not really going to work because this goes a little too deep. And so the problem with this is, even though you might see some sort of mild improvement, and you may be happy with that mild improvement, it's really difficult to maintain for the long term. I don't know of anyone that you can find online that can say definitively that they have continued their derma rolling or micro needling regimen for longer than a couple of years. It doesn't seem like a good idea, and I can't speak to what the long-term scarring effects would be. I've had a lot of people talk to me or ask me questions about the long-term scarring from SMP, and it's a very legitimate question. But with something like this, you're getting a lot more needle injections over time, or needle punctures over time on the micro level, that I think, I could be wrong, I don't know, but I don't know of any long-term scenarios where this can be looked at, but it may or may not be a good idea because of that potential scarring issue. But more than anything, it's the pain issue. You're literally subjecting yourself to a little bit of torture every couple of days when you're doing this. So I think that if you are one of these people looking for a treatment without using medication or without using lasers or PRP or even surgery or anything like that, you'll be looking at microneedling. You'll be looking at derma rolling as a possible treatment. But in the long term, there are two problems with it. It's not going to do much. And the biggest, the people with the biggest visual benefits will be people that are bald, that have a lot of maybe vellus fine hair. Someone like myself, I'm not going to see much. Like if I was actually using this on my crown and my part line after I had a PRP session with Dr. Cooley in Charlotte, and I've continued to use it after the fact. It's been 2.5 years since my PRP treatment. The idea is I use it on my part line. It might thicken it a little bit. No one else would notice it. I might notice it. But the biggest visual impact will be for those people that have a lot of hair loss, a lot of vellus hairs on the areas of loss, and you might see a difference with it thickening, getting darker over time. But again, the second issue is the long-term plan to do this for life or until something better comes along. I don't see that being a legitimate, viable long-term plan. That's microneedling and derma rolling.
Well, I can tell you this. I have a brand new in-package sterile microneedle. It's or a micro needling roller that's 1.5 millimeters. I did utilize these for some time in my world, many years before anyone, and this is old, before anyone ever wrote about microneedling on the internet. I was introduced to microneedling back in 2001. So I never chose to write anything about it, and I kind of watched as the internet, as it normally does, just takes things over and kind of blows things out of proportion, and how certain papers are being written by certain doctors getting into certain publications that don't necessarily mean anything, very small studies. There's a study done in 2013 that did show that the minimum depth to have any type of response is 1.5 millimeters. And when you are microneedling on your scalp without anesthesia with 1.5 millimeter microneedle on a roller, Joe is right. that shit hurts and it bleeds in many cases. In order to get full penetration, you actually have to press to the point, in most cases, where it bleeds. Now, there will be doctors out there and there will be bro science guys out there that will tell you that is not true. But according to studies, that is true. Latest study came out, or I call it a study, they're very small, that was published by, on the NCBI, 2018, I think it was, and essentially states pretty clearly that there's still no causal effect that has been shown, at least according to this study, and that the biggest advantage is it looks like when you pierce your skin like that the topical medications will have better penetration. So yeah, great. I definitely think that it activates wound healing. Wound healing, we know that for a fact. There are doctors out there who will say, well, you are not puncturing the skin deep enough to cause fibrotic tissue, and that fibrotic tissue will only sit at certain layers or develop at certain layers of depth. That is not the case. You can have a very shallow wound. If it's long enough on your scalp, I'm not talking about a micro wound. I'm talking about just wounding the scalp at the epidermis. You will form scar tissue, period. Now, if you are micro needling consistently and puncturing your scalp once a week, twice a week, once a month, whatever it is, on a long-term basis, you will have fibrotic tissue that will form to some degree. End of subject. So, I mean, I would love to have a physician who promotes microneedling come on board and talk about it. But the reality is after, again, I was doing this well before it was ever talked about or written about. This particular micro needle has to be 8 years old, something like that. And this isn't even out of the package. So I've tried it. I've been there. And as they say in the UK, I have a T-shirt to prove it. And the reality is, even though I know a lot of respected guys who utilize microneedling with PRP and other treatments, I have never met anyone or been contacted by anyone who had any significant regrowth or results long-term with the use of microneedling alone. And honestly, I believe that in the long term, most people will quit, and it is a big waste of energy and time.
Yeah.
So when you're looking for hair loss hacks, in my view, microneedling is not one of them. And I think that in the long term, it could do you some damage. The phone number is 888-659-3727. And again, we are both not physicians. We're not claiming to be physicians or giving you any medical advice. This is based on personal experience. This is based on, countless people have contacted me over the years. Also based on the experience of physicians who have been in this field for a long time that have been relayed to me. And also, based on like the groundbreaking PRP hair guy in this field who does recommend microneedling for the face, microneedles for PRP, does actually send people home with microneedles or a derma roller after their PRP, does believe that derma rolling can benefit. He's not sending you home with a 1.5 millimeter microneedle because he understands the damage that can be done at home with home use. So I don't know if that was clear, but we're not calling complete bullshit here. And we do know that there has been some results shown, but there's been a lot of results shown with minoxidil as well. And, frankly, if minoxidil really did the trick, we wouldn't be in the position that we're in today.
Exactly.
The phone number.
So
go ahead.
That's the truth about derma rolling or microneedling for hair loss.
There you go.
Onward and upward.
888-659-3727. That's 3727. And by the way, I used this shit for a long time. 2 years, maybe more. I was also using it on my face. Apparently, it worked for my face. I'm just kidding. Anyway, guys, let's take a phone call.
Because actually, he's 93 years old, so it obviously worked.
Damn, that hurt.
Sorry, give it away.
Hey, man, you're on the air. Who's this and where are you calling from?
Hello?
Yes, hi.
Hello?
Can you?
Oh, hi.
Can you?
Good evening. I'm so pleased, that you guys answer my call. I really appreciate. I'm calling from UK, London.
Well, welcome, man.
Welcome.
What's your name?
My name is Rui. I'm from Portugal, but I'm living here for almost 8 years.
Okay. Well, welcome, man.
Thanks for calling.
I'm so excited that I don't know what to say really. And so you guys are a big inspiration for me and for this community really. Unfortunately, I did a mistake like for many of us. I went to Turkey and I had a hair transplant that I didn't need it, and ending up to go now to have a second procedure with another doctor here in Europe.
Okay, well, I want to kind of guide you along with this story because this is a very important cautionary tale. Tell me again. I don't know if you told us your age. Tell us your age, and and tell me about your experience in Turkey.
I'm 32 years old.
Go ahead. I'm sorry. I can't hear you now. Can you talk into your speaker?
I'm 33 years old.
33. Okay.
Yes. Basically, I never I always since young age I always thought that I had a big forehead, but I wasn't feeling at all. Even on my back, and I probably was a Norwood 1.5, 2 at least. But just my forehead was always big, because on my father's side, my father actually is bald, and my grandfather. And I always had that feeling that, I was going to lose my hair, every time that I look in the mirror, I didn't like what I saw. And, I was looking online, and, of course, I didn't know now what I know. And I went to Turkey because it was very cheap and was very appealing, and of course, being a nurse, I did a mistake. I should know more about the risks of every.
All right, I'm going to stop you there because that is also a very compelling statement that you just made. You are a medical professional, and even though you're a medical professional, you were still able to be lured into having an inexpensive hair transplant by the type of marketing that was presented to you online.
Exactly. I was so foolish, and being 32 years old, and being a nurse and everything, I was so caught up, in the price, and, I went there, I paid already the deposit, I paid for the surgery. Was basically, I saw the doctor, or actually I went to the plastic surgeon and he told me that he had a friend that will do the procedure for him. He's very experienced. And I trust, because being a nurse, you have to trust mostly when the doctors they tell you something, So was my mindset, And in the day of the surgery, I arrived there at 8:30. I still remember the time actually, and I sat on the chair. They drew my hairline, and this friend came alone. He couldn't speak any English at all. He drew another hairline, fortunately, he drew it slightly up than the other one.
Now, let me ask you a question. Was his friend also a physician?
Well, I think so.
Okay.
I think so.
So that's actually
scary,
that's pretty telling too, because you don't even know what his credentials are. You had surgery with this guy. Again, this is just a cautionary tale for other people. So I'm not here to try to reprimand you.
No. And if you're doing, I deserve it because I was foolish and I was so eager, want to try the results that I didn't look for the things, that I should look.
Like if the person who was operating on you was actually a physician, and that would have helped.
Yeah.
Yeah.
Yeah, exactly. And it's just you went there. It's from my airline. They didn't shave all my hair, so basically they did a FUE with all my hair. They just shaved on the back to take the grafts. And what he did, he opened the channels. He was very fast, opened the channels, and he took some grafts. And afterwards, it's just assistance, really. During the procedure, I was like shaving. Probably my blood sugar was really down. They were giving me like sugars, and I was having IV fluids. And after that, I went home. I didn't have any problems with necrosis or anything. The hair grew, but it's like in one side looks normal, but in the other side looks very plaguey, and looks very I can cover with the rest of my hair because I'm very dense in the back, so I can cover. That is my luck, but basically the hair doesn't follow the natural direction of my natural hair.
Right.
So and now I've been following your program since like a few months ago, really, and you guys are so inspiration for me. And I started as well taking finasteride since January, because when I went to the surgery, even the doctor didn't tell me about the finasteride. He just told me, "Oh, you just need to take these multivitamins and you are fine. You don't need anything else,
Yeah, I mean I find that pretty fascinating. That any hair specialist or dermatologist or plastic surgeon would even suggest that taking multivitamin would help you with genetic androgenetic alopecia.
Yes.
So that's a red flag right there. But listen, just so you know, your story is not atypical, and actually, the only thing that's atypical about it is that you didn't have technicians doing 100% of your work, unless the person who was excising or dissecting the grafts was not a doctor. I have no idea what that person's credentials are, but usually what happens is they just have very young technicians who are doing both parts of the procedure.
Yes, like for all the listeners here on the show, I would like to say, please, if you go aboard, I'm from UK, and I have to tell, I totally agree. Most of the hair transplant doctors here in UK, they are not good. They are not good. They advertise, they're the best, but they are not. In Turkey, please, I'm certain that, there are good surgeons there, but most of them, they are not good.
I would say that, and there are some good surgeons, and that's what really bothers me about this whole issue with the Turkish market. And also bothers me with the way that, like, the large educational organization is going about things, kind of creating this black market, when the black market is all over. The UK is one of and was known before Turkey came into play as the most dangerous market in this field forever.
Absolutely.
Forever.
For years.
And I have to say that, and go ahead, Joe.
No, I was just going to say, I mean, when I first got into this industry in the early 2001, 2002, I remember looking online, and out of the UK there was nothing. It was Europe in general was pretty bad, and keep in mind this is before FUE came along. It was all strip work, and there really wasn't a clinic that stood out as being worth considering. But in the UK, it was far and above worse than anywhere else.
It was an absolute disaster. And I can tell you, my organization is an international organization, and we have received, I have to do a new count because we're getting so many applications. Now, it may actually have gone over the 2,000 mark as far as people have applied in the last 20 years. And everyone in the UK back in the day, and still to this day, applied to the IHRS. It was almost impossible to find anybody that was even reasonable until maybe 2006, around then. And then I brought somebody on from the UK. But now I think we have 3 UK clinics that we could even consider suggesting.
Yes.
And it's
Yes.
it's horrible, dude.
You know,
It's such an ugly field in the UK.
I saw one of the doctors in UK. I saw here. I saw in London. Actually, it was Joe. He recommends with his doctor. I don't know. I can't remember his name.
Edward Ball.
Dr. Ball at the Maitland Clinic.
Dr. Ball. Yes, I saw him.
That guy's really good at what he does.
Yes, but he's good. But you know, because now I'm more aware of things. When he saw me, he was very unsure because he said, "Oh, I never done a big surgery like this because your hairline is unnatural, and we have to remove all those grafts, and probably your only option is to do like forehead surgery when they push down the forehead." I can remember the name.
It's a brow lift or just hairline removal. For him to say that about your case, I've seen his repair work in the past, and he's very good at repair work. For him to say that means that your case there's definitely a lot of work to do. So I would. Yeah, you said you were concerned about that. You're worried about that, but Dr. Ball knows what he's doing. When I first discovered him and observed his particular skill set, I was really impressed. And he one of the things that he's been doing a lot of is repair work. And I don't think he gets enough credit for that, but he certainly knows what he's doing.
But Joe, yes, I agree. You know, he saw my density. Actually, it was through him that I started the finasteride, the Turkish. But after having his opinion, because I think he's for me, you know, like although my hairline, no one can see that I have a hair transplant because I can cope with my natural hair. You know, that is my lucky thing. You know. And I'm very dense from the back. I'm not thinning in the crown or anything. And I went to see as well. I know it's one of the doctors as well that you follow as well, and was there in the program as well, Dr. Lupanzula.
Sure.
Yep.
And he didn't tell me about this surgery. He told me that my case, is not easy, but it's not the worst that he had. And I had his assessment in London, and he told me that he could fix me. So I booked surgery with him this month.
And I have to say that here's the thing about medicine, and the practice of medicine. That's why it's called the practice of medicine. There is nothing that's written in stone when it comes to surgery or how physicians look at things, especially when it comes to aesthetic medicine. In Dr. Ball's eye, to his eye, and as far as what he feels most comfortable with, that's what he told you. Dr. Lupanzula has a completely different experience in life and in medicine than Dr. Ball. And you're in medicine, so you understand that. So to Dr. Lupanzula's eye, and based on his personal experience, it's his belief that he can fix you in a less aggressive way.
Yep.
Yes. Yeah. I think Dr. Ball would like my hairline to be a little bit higher, considered to my age, to prevent any fall or hair loss. And Dr. Lupanzula just told me that you're going to remove at least 50 plaques. I don't know if it's too many or not. I don't know in your age, experience, 50 plaques probably is too many for my temples, because one of the temples they did all right, but the other one on my right is very like the plaque style. It's not very dense.
I can tell you, and sorry for interrupting, but I can tell you that Dr. Lupanzula has a lot of experience removing a lot more than 50 grafts from a hairline. I was working with one patient in the UK. He's known. He's a celebrity in the UK, and he had to have.
I know.
I believe
we are talking about.
Did you discuss the case with him?
No. But I know. I'm not
I don't want to
gonna
name
tell
any
the
names here.
program, of
I
course.
can't.
No.
I can't name any
I
names
know. I
here.
know. I
But
know.
he
I
did
don't
work on
want to say as
a
well. I don't want to
yeah.
say it's not fair.
Yeah,
I'm
exactly. It's not
acknowledged that.
fair.
Yeah.
But
No.
to the point, I think about 200 to 300, over 200, maybe almost 300 grafts were removed in one pass just from his hairline and the temples because it was that bad, and it turned out really well. He's still recovering from a second pass to rebuild a more natural looking hairline. Hopefully that'll be revealed in the future. But yeah, he certainly has that experience. So I think that obviously with Dr. Ball, I feel you have been in great hands, but knowing Dr. Lupinzula personally, having been to his clinic myself, I think that is also a fantastic choice. And so good for you. I'm glad you
Thank
have
you so
spent
much.
some time finding someone
Yes.
that is better qualified for your needs.
Yes, you know, and it was from your program, guys. You know, when I saw the show, actually, you know, they started searching his name, and you know, I have always just positive reviews about him. You know, and he's very approachable man. He's very honest. He tell you what you need, and he tell you know the real expectations. You know, I don't want a perfect result. I just want a normal result that I can follow my life, you know, because basically, you know, I've been suffering with this hair transplant. Although I can cover, you know, I basically, you know, days, nights, I cannot sleep, you know, I cannot social, you know, I broke up with my girlfriend, you know, even sometimes I have to call off sick because I'm not good to go to work, you know. So my life was totally destroyed, you know. So now I just want to move on, you know, with my life. And hopefully as well in the remove of the plugs, you know, will not leave too many like kind of scars on my face or the skin. I don't know if you guys saw any like work where the doctors they remove the plugs in the frontal hairline, and it's very visible, you know, in terms of the scar.
Yeah, I mean, I've seen a lot of it, and it really depends on the person. It depends on their coloring. It depends on how much sun they get. It depends on the size of the punch.
What I'm almost afraid. I'm most afraid just the scars because I already have one on my face, and you know, aesthetically, you know, I cannot, you know, I have another one, you know, someone looking at me, you know, thinking, you know, it's just, you know, it's probably just on my head, you know, but yeah.
Well, listen, the reality is that it's possible that if some grafts are removed, that you could have some incidental discoloration, hypo or hyperpigmentation, and something that could be visible. A lot of times that's not the case, especially if the hairline that's created is really natural. And if it's not incredibly visible as far as the scarring is concerned, the eye doesn't naturally go to that area. And I'm sure there's not going to be that much of a space between your hairline and the grafts that are removed. So, you know, this guy does know what he's doing, and he's really good at what he does. And I think by him making that suggestion, he's probably pretty confident that you're not going to have any visible scarring, but you just never know. And that's something you have to be aware of. You never know.
Exactly. Yeah, that's true. You know, although if a doctor is good, you know, you never know that you guarantee the same good result that probably other patient has. So
that's right.
You know,
but I want you to. I'm glad you're aware of that. But I want you to. First of all, I want to say that I really, on a personal level, I'm sorry that you had to go through this, and I understand.
Sorry. And I'm sorry for this call. You know, I'm so nervous. You know, it's because going through this again, you know, makes me so nervous. You know, so angry. You know, so like, you know, it just. And sorry, Spencer, to interrupt you again.
Oh, no, it's okay. I understand, and I think it's important that you get that out. I mean, anybody would be. And it's unfortunate that, you know, I had an interesting comment on our Facebook page. I guess it was somebody who saw, who just stumbled upon our page and saw a video interview I did with one of our members. And we were essentially just talking about the reality of this industry. This was a very bald person who wrote, that, this type of content should be illegal. You need to stop bald shaming and, whatever he wrote. There's something really, that I guess he didn't really take the time to watch our content. But the reality is, if more people would share that content, more people would share that content, and if we were able to get it out there in a much, much bigger way, meaning that the physicians involved share the content, consumers who watch this program share the content to spread the word, then situations like yours just wouldn't happen.
Yeah, that's right. It's because it's, being a nurse, if I do my job not properly, they can blame me, they cannot put me in front of my, my organization and take my pin away or my ability to work more as a nurse, But these doctors, some of them, they both have hair transplants, they are not, they are not hair transplants, they are not specialists, No. They do fillers, They do fat transfers, They do lasers and they do as well hair transplants, This is not right, And someone needs to put a stop on this, And nowadays, most of these plastic surgeons, they just want money. They don't care about patients. They don't care if they go home, when they are alone, and the results are not great, Who's going to help them, They not understand that, They are happy because they receive the money, they wash their hands, and we are here suffering, Suffering because of our fault, it's true, but as well suffering because of others. They don't have the moral, to see they are treating a human being,
Well, and
that is very disappointing.
That's very true, and that is the whole point, And yes, do patients need to take responsibility? They do, but the problem is it's so difficult. It's so difficult for you guys to decipher what's real and what isn't real. Sadly, people find us sometimes, or a lot of times, after the fact because we don't sell anything. They want to go and get fixed. They want to go to the people who are selling something, a promise of them getting a better life. We don't do that. We're here. We tell the truth, and we're like, you may not be able to be helped, dude. You may not be able to be fixed. Surgery is probably not for you. And most people don't want to hear that. And sadly, I've had guys who have called my program, and then 7 months later, I told them they're not a candidate for surgery. 7 months later, and this is way back too, like when I was on the radio, said, you're going to kill me, but I decided to have a hair transplant anyway, and you were right, and I don't know what to do.
I think nowadays the problem is as well the marketing. The marketing is too strong. There is so many things. The best FUE, ice FUE, the best machine, the best that, and but who is doing the FUE is the doctor. The doctor is the skills. How many years of experience? Tell me the passion about this doctor about
but even that, you see doctors putting themselves out there and saying how many years they've been doing this and how much skill they have and what their credentials are, but then when you go into their office, they're not doing the surgery. So a consumer has to go even deeper and say, okay, when they sit down, and this is the information we provide you guys with, say, doctor, how much of the surgery are you going to be involved in? And if they say, well, I only make the recipient sites and we have a great team of technicians. And then the next question is, okay, fair enough. If it's legal in that state or province or part of the world, let me know about your technicians. What's their experience? Can I see their credentials? And if they're unwilling to show you that, and if you can't see how much time on tissue these technicians have had and actually see their work, or go to a procedure and watch them work, then you check them off your list.
Did you ever? Sorry, caller. Did you ever mention the name of the clinic in Turkey you went to?
Was a general plastic surgery clinic. Was Dr. Becker? I don't know the last name. It's based in Istanbul. I don't know the last name actually.
What's the name of the clinic?
But sorry?
What was the name of the clinic?
I can check here online. But basically the clinic was his name. Just a minute. Actually, I was fortunate enough because I complained and I asked for my money back, and he told me, "Oh, you have a good result," and I say, "No, I don't, and I want my money back." And at least they give me half of the fee that I pay for. So at least
That's
it's
more than
not,
most people would get.
Yeah, it's not enough, but at least it's good. The name of the clinic is his name, so it's Dr. Becker Boyok. I'll send for the chat though. I'll send for the chat the name. And and just in UK as well, I saw Dr. Ball, and I went as well to see another doctor. Actually, and I was aware because you guys on the show told us all to be aware of the med spas when they offer hair transplants. And I went in UK as well to a med spa where the doctor does as well everything. And he told me, I'm a specialist in hair transplants. And, I was sitting there on the chair and I say, okay, all the consultation, he didn't check my my donor area or anything. And I have to ask him, so doctor, you're gonna check if I have enough grafts? And he told me, oh, you have enough. I don't need to check. His assistant was there in the consultation, and she was all the time in the mobile phone. I don't know what she was doing, and
she's on fucking Instagram.
And yes, on Instagram, like yeah.
Or maybe
yeah.
she was checking out Tinder for who she was going to that night. I don't know.
I was going to say you should probably check that clinic's Instagram feed to see if you're in it, because she might have been saying having another consultation with a patient during hair check days or whatever the hell they want to call it.
Yeah.
But I'll say this: I can't legitimately think of any hair transplant specialist that's legitimate. I could be wrong, but off the top of my head, I can't think of anyone that's legitimately a hair transplant specialist and their clinic is called a Medi-Spa.
Yeah, and he was
doesn't
so
work.
Confident, He was so confident. It's those type of guys, they say, oh, I do this, I do that, but on the end, they don't do nothing, I have my suspicions, and he was saying, oh, yes, your case is very easy, I can fix that, I can really fix this is easy. And he gave me the price, and after he told me, oh, but I can give a discount. But I told him, look, if you're a good doctor, if I can trust you, I don't want a discount. I want a fair price, that I need to pay. Yeah. If I need to pay for a consultation, I want to pay. And I want to pay the full price. But, I want to have a good result this time, a normal result.
Look, if you're going to, and we're going to have to let you go and take some more calls, but if you're going to any place, no, it's fine. This is a very important call, and I appreciate you taking the time to call. And I'm glad that we've been able to help you, at least guide you in a more reasonable direction, so that you at least have the wherewithal and the understanding of what goes on out there, and what you need to do to possibly help yourself move forward.
It's a very dangerous world. It's a very dangerous, It's a hair transplant. It's a very dangerous world and dark. It's really dark.
Dark is an interesting word. It's a word that I've been using for many years, and I'm going to be completely candid with you. It is not. I was actually shocked when I started to research the mainstream cosmetic surgery, plastic surgery world for some programming that I'm doing and have been working on for the last 5 years. I realized that the hair transplant industry, while it is kind of like a subspecialty of cosmetic surgery, it's no darker than the mainstream plastic surgery industry. The mainstream plastic surgery industry is just as dark, if not darker, just by virtue of the sheer volume of fuck-ups.
If I was a doctor and if I was a hair transplant doctor, I would be ashamed, it's because if I wouldn't do a good job, or at least a job that, I was experienced with, it will be my name that will be a shame, And I think nowadays, some of the doctors, they don't have pride on their name. It's because there's so many doctors there, they are praised there. they are good, but, you're going to see the reviews and you talk with the actual patients, not fake patients, and they're unhappy, their lives are destroyed, families destroyed, it's just, and anyway, just a quick one. I don't know if you guys know, I had already a Skype consultation with the doctor because I'm Portuguese, and I don't know if you guys know because he as well talk about you guys very well. Dr. Bruno,
I know who you're talking about already.
Okay. I of course you guys are friends, so I cannot say anything. But
go ahead.
You can say whatever you want.
Yeah, say whatever you want.
He seemed a nice guy, but I don't know. I had a consultation with him, but I didn't went through yet. But because I discussed already with Dr. Lupanzula, but I don't know. He seemed too much eager, on the emails because we talked through email and we did a Skype, and I don't know. I didn't felt that it could help me. And although he worked for one good doctor, probably it's a good doctor, I don't know, in Spain, Dr. I don't know, Lorenzo.
Jose Lorenzo.
Yeah, but some of her, this Dr. Lorenzo, most of the photos that I see, it seems so good to be true, And Dr. Bruno is very, is very friendly, but I didn't felt very confident with him. I don't know you guys, what's their opinion about him,
I'll tell you about Dr. For the viewers and listeners, he's talking about Dr. Bruno Ferreira, who is he has a clinic. I'm not sure if he's still operating out of it in Porto, Portugal, but he's currently working with Dr. Jose Lorenzo in Madrid. He is, in my opinion, one of the future leaders of this industry. He's really good at what he does. He's young. He's very young, but he's really good at what he does. And the great thing about this doctor is he's passionate as hell about doing the right thing. I've known the guy since 2013. We met at the ISHRS conference in San Francisco, and I've had the pleasure of becoming friends with him over the years. When we run into each other at different conferences and we talk online, and I think that I don't know what he told you, and you got one feeling about him, that's fine. But I can say, and I've not gone deep enough into looking at I've not reviewed him or anything like that. But just as a person,
of course.
He really cares about what he's doing, and he wants to create the best results possible.
Yeah,
and you also have to understand that some of these guys are going to be eager. Some of these guys, they want to get more cases under their belt. They want to prove themselves. They believe that they can help you, and they're going to be eager. They're not just going to sit back on their laurels, or they may not be booked out like some of these older doctors. Yeah. And he's like, okay, well, listen, we have a patient here who I think I can help. I'm going to try to close this patient, and frankly, I hate to say it, that is the nature of this game. Some people aren't in the position where they have to do that. Some people are trying to do that so they can get, obviously, more time on tissue, and they also believe that they could make a difference in your life. So I wouldn't hold that against him, but I think that, for yourself, you have to go with your instincts. And if your instincts is Dr. Lupanzula, in my view, you made a very good decision.
Do you think really, in your guys' opinion, of course, it's just your opinion, because I saw a case like mine that Dr. Lupanzula fixed, and I was amazed with so natural results, not perfect, natural, Look,
the guy is really good at what he does, but like I try to tell everybody, and he's an accepted member of the IHRS. He works with Joe directly as well. But I try to tell everybody, anybody can fuck you up. Even the best surgeon with the best experience and the best technicians, you could have a bad day. Anything can happen when you have cosmetic surgery. So what you have to do is you try to hedge your bets, and you try to do your due diligence, and you try to mitigate any possible damage by doing your due diligence and going to the people who have the most consistent track records and who you feel most comfortable with. So you've done all of that now.
It's like, yeah, you guys, thank you so much. And sorry again to always cut, you know.
No.
I really apologize.
I don't apologize. I appreciate your call, and I know how difficult it is to go through what you're going through. You've done some good homework, and you know, it's.
I'm so nervous, you know. It's because, you know, I work in a hospital, you know, and I work in a ward, you know, that, you know, everyone knows me, you know, and when I go there, in my head shave, you know, because I was just gonna have 3 weeks off, you know, and you know, after my hair is gonna be falling, you know, and everyone's gonna saying what's going on with your hair, you know, and you know, I'll be like self-conscious, you know, I'm just gonna be like.
Keep in mind,
you know,
keep in mind that when you shave your head, and just like, you know, a couple weeks after your surgery, that's the worst they're going to do is ask you what's up, what's going on. You just say, oh, I got tired of, you know, I just want to shave my head. Most people will have no clue what you did. Okay, it's not like back in the days of strip when you know you go to some clinics to have a strip surgery and they shave the back and sides of your head completely, and then they shave the top to put the grafts, and you got this funky haircut that you can't continue to shave because you got this, you know, a bunch of staples or sutures in the back of your scalp. That's completely different. Everyone knows then. But with FUE, especially when it's done properly, a few weeks later, it's like, you know, only people that have had it done themselves will know what they're looking at, if they even notice it to begin with. You know, so especially your patients, they're not going to notice. And those around you are just going to know that you have a shorter haircut. So one thing I'd recommend is, you know, maybe get some sun, like, you know, go out and get a little bit more color to your skin if you don't have any. You know, you might be pasty white, or you might have a little bit of color already. But that helps to kind of blend in so that when you do shave your head, it's not going to stand out as much. You're not going to have like this white head and, you know, kind of, you know, sun-kissed skin everywhere else. So, but don't let that be a big issue, because I'm telling you, most people will have no clue. All right, so don't let that be an issue for you.
Because with Dr. Lupenzel, I'm gonna have 2 procedures as well. Gonna be this one in May, and they suggest me to have another one to work after on the front line, on the front hairline. But, you know, anyway, you know, I'm taking too much of your time, guys, you know, and I want to give time to other callers, you know. I think it's important as well, you know.
Well,
and
I thank you for that. Listen, I wish you the best of luck. Say hi to Dr. Lupenzula, and
I will.
You know, I personally believe you're in really good hands, and you understand everything that can possibly happen. You've done your homework this time, so I think you're going to have a much better experience.
Agreed.
Thank you so much.
Okay.
And I just want to say my final thoughts. Thank you so much, guys, for this program. Hope, you know, although I know it's tiring, you know, to have all this program, you know, for many years, you know, and you guys basically are here to help us. And some of the people, they don't understand that, you know. And so we need to be grateful, really grateful for you guys to be on the air at this time, and to be available to answer our calls, you know, to deal with our frustrations, you know, to pressure most of the times, you know, and to always be there to help us, you know. And I think is a great thing to do nowadays, you know, because nowadays people give something but want to take something as well, you know, and you guys are just giving, you know.
Well,
and that is a
listen,
great thing.
It's thank you so much for that sentiment. But if you want to give something, all you have to do is find a way, without being embarrassed, to pass this forward, share this with people somehow on the internet, let people know about this broadcast, even if you do it anonymously. Let people know, because the more we get this out there, the less people are going to have to suffer and go through what you went through.
Yeah, no, I'm very surprised here because a lot of people they don't put likes, on their live streams or anything, and so many people watch, so many subscribers, it's a recognition, that your guys need to have, because basically you are transforming lives, you are changing lives, for the better actually.
Well, listen, when I hear that, it makes me want to continue doing what I do, because the shit that I deal with on a day-to-day basis from some motherfuckers out there, and also just the industry itself, most people would walk away from this. But Joe and I, and Joe's kind of pulled me back in. We believe in what we're doing, and that's kind of what gets us through it. So thank you so much, man. Listen, go ahead.
And the good thing as well, it's just you guys, you two work synergetic really well, because you guys have both experience, and together you guys is an amazing show. Anyway, guys, have a good night.
Thank you, man.
Thank you so much for something.
All right.
Thank you.
Good luck.
Thanks for calling.
Take care.
Thank you. Bye-bye.
Man, I got to cut that up for our reel.
I'm telling you. Yeah. Great call.
Unbelievable. All right, guys. 888-659-3727. We're going to take a phone call. We'll take one now. But I know we have some other stuff that we wanted to talk about. But you know what? These guys have been holding on for a while. So let me take a call and see if we could get to what we wanted to talk about earlier. Hey, man, you're on the air. Who's this and where are you calling from?
Hey, it's Nico. What's going on, boys? How you doing?
Nico, what's happening, man?
What's up, buddy?
Hello. Yeah, it's nice to see some guys present something without reading it off a Google screen today. It's nice. So thanks for giving us some honest info about derma rolling.
Thank you, man.
Real. Now, I saw that when you guys put up the screen for the video. I was like, oh, I like the direction for getting the right for the truth out. So
well, we realize, what, this is just, it's important. It's just, the clickbait is just, it's over fucking whelming, man.
Yeah.
And
anyone deserves to get the views you do. So
and I see these guys who are then commenting on these things, and these complete non-experts, they're trying to develop an influence, and maybe they've been derma rolling for 5 months or 3 months or whatever it is. I mean, it's just, the whole thing is just fucking ludicrous.
Yeah. Well, I'm not looking to get work on minoxidil beard or anything with derma rolling, so. I do have a derma rolling question based on what you guys were talking about at the beginning, and I know if we're talking about just for a short-term plan for derma rolling, can it help with stimulating follicles coming? I asked this in the chat, coming out of the telogen effluvium. If you were using it for short-term purposes?
That's an interesting question, and I would say that theoretically, yes. It certainly can help, but we also don't know what potential damage is happening. Again, we don't know. Everybody's different. I certainly believe that no matter what they tell you, you are causing a minute amount of fibrotic tissue every time those wounds heal. And if you're going in time after time after time after time, what is that tissue going to? How is your hair going to react? And will, if it does grow hair, will the hair grow to a full terminal stage? Is it going to be compromised somehow by microscopic scar tissue?
Right.
We just don't know.
And so no bueno over a FUT scar, right, for helping with healing at all, too? Same deal?
Well, I would say that there's a lot of doctors who would say, it will increase blood flow to the area and may actually help with the healing of the scar itself. Mm-hmm. And I have seen some really good results when it comes to acne scarring and when it comes to other types of scarring. So, I guess, again, I'm not a physician. I guess there is some logic to that. Joe, what do you think?
I would say you couldn't pay me to do microneedling on a still forming donor scar. But after it's completely formed and done what it's going to do at, say, 8 months onward, I see no problem with that, because it's been shown that when you go into an area of scar tissue with multiple wound breaks, be it through some sort of needle, if you're making incision sites for graft work, if you're hitting it up with a needle for some sort of SMP, the scar tissue will actually change color. It can actually change to look more like skin tissue. Not that it turns into skin tissue, but the blood vessel formation that comes after that, which is what happens when you have wounds. New blood vessels are formed to get to that wound to help it heal. That can help to reduce the visibility of a scar. How much? It's highly variable, but there's a lot of observation of that phenomenon throughout the industry with clinics that have given this a shot. Either through, I mean, we saw it when I was working for one clinic. We saw that just from doing a procedure on top of scar tissue. I'll never forget. A patient came in, flew in from Italy, had a complete helmet of scar tissue on his scalp because he had burned his scalp as a child with hot oil or boiling water or something, and he lived with it all of his life. And 3,000 grafts were placed into the scalp, and they grew beautifully. It looked like nothing less than full growth, full yield, but the tissue itself had gained almost like a skin type of coloring, as opposed to just looking like white scar tissue. It was my first exposure to that, and that was like 13 years ago. So, and I've seen numerous examples of that since. So once it's formed, knock yourself out. Give it a shot.
Cool. I hate to ask a novice question, but I know that finasteride and minoxidil have different indications, different purposes, uses, etc. Why technically wouldn't it make sense? And it's probably such a stupid question, but I'm going to ask it anyway because I'm sure someone's going to want to ask it at some point, is why wouldn't finasteride hold on to minoxidil growth that becomes, hair that becomes terminal as a result of minoxidil without always having to use it as a Band-Aid? If that makes sense.
It's actually I'm going to say brilliant question. That's a very good question because it's something that I've thought about for years. Even though, and it's kind of like, okay, we know there's different mechanisms, and I'm going to let Joe answer. He was about to answer. I cut him off as usual. But we know that the growth is caused by different mechanisms, and you think, wait a second. So if minoxidil kept my hair in an anagen phase for a longer period of time, then finasteride should, pick up the slack once I got off of fucking minoxidil. Totally makes sense. Why doesn't that happen? Well, we don't actually know. Except the thought is, once you remove that vasodilator, that the hairs that actually stayed in anagen phase may not have had a reversal of miniaturization just by lowering DHT. So you might not have had, and that's why these doctors want to combine both, because they think you're going to get the most visual bang for your buck at the beginning, which sometimes happens. But I mean that's the only thing that I've ever heard. The only possible reason why finasteride doesn't seem to hold on to any hair that was kept in an anagen phase longer from minoxidil.
I equate that question to the question of why won't my car, once I run out of gas, run on steam power? Two completely different ways to power a vehicle. Of just a rough comparison. One works in one situation, the other works in another situation.
Yeah, but I totally understand his question because it's totally logical. Because even if one works in the other situation, another has another mechanism of action. If the hair is there, why won't the finasteride keep that fucking hair growing?
Right.
So
it just came to me earlier.
Yeah, but no, that's one of the real sucky things about dealing with hair loss, man. We have limited options that have, and everybody who's using these limited options have their own experiences, their averages, of course. But it would be great if everyone who's dealing with male pattern hair loss or male pattern baldness was able to be helped by finasteride. We know that's not the case. So I mean,
and the real
I just
answer
got really
to that question
depressed.
is basically because we're all doomed to misery. That's why it doesn't work.
Yeah, I just got really depressed. I really feel like going drinking after the show. All right, Nico,
well,
man.
Let nature take its course. I was going to say, update-wise, I was prescribed oral minoxidil, but I'm holding off and just letting see if, nature takes its course. I'm just asking some questions, and I thank you guys so much. Have a fucking great weekend.
Nico, man, you too. Be well, and thank you so much for your patronage and the support for all these, couple of years you've been calling.
Yeah. It's symbiotic. It works both ways. Thanks,
All right,
guys.
man.
Have a great weekend.
Take care.
Well,
see you, buddy.
All right, guys, we have some lines. The lines are full. Actually, we have one line open now. So it's 888-659-3727. But hey, man, you're on the air. Who's this?
Hey, is this me?
It is you. Who's this? Where are you calling from, man?
All right, okay. Hey, man, sorry. I was listening to your story, and I kind of was zoning out there for a second. But I guess to sum that up, there's crazy people all over the place, man. So you gotta use your bullshit filter,
Well, listen, I'm not saying anybody's. I appreciate you saying that, and that's true. But I'm not saying that this guy's crazy or whatever. All I'm saying is, I understand why he's obsessed. If he's unhappy and he believes that he's been harmed, but you gotta have to deal with it in a reasonable way in order to get a resolution.
Right.
That's it.
I hear you.
Yeah.
No, good call out, man. I appreciated the story.
Okay.
I like listening to your perspective.
Thank you, man. So what's up?
Right on. What's up?
First of all, I'm Morgan from Oregon. I've called in a few times. I've actually been trying to call in, here and there, but I haven't been able to get through. And finally today was a good day, so I held on just to kind of give you guys an update on where I'm at with things. So, first of all, I want to thank you guys for kind of convincing me to hang in there with Propecia. So I've been on it for about a year now, and I took Joe's advice of doing one pill a week for a month, and then 2 pills a week for a month, and then 3 pills a week for a month. And I just kind of wanted to update you guys on my journey on that.
Yeah, sure.
Okay. Yeah, absolutely.
Yeah. So I did that, and then I got to 3 months, and then I started feeling like I was having anxiety at 3 months when I started taking 3 a week. And I think in hindsight now, I think a lot of it was just kind of my own internal paranoia about it. Because once I got to 3 months, I quit for 12 days, and I had called you guys, and I said, I feel like maybe I'm having anxiety about it, and that type of thing, or getting anxiety from it. And Joe was like, well, he asked me how long I'd been off of it. I said 12 days, et cetera. And he said, well, I would recommend just backing it down, and maybe even just starting over at 1 pill a week and going from there. And so I took his advice, and I went back, and I got back on for 1 pill a week. And then I got back up to, once I was at another 3 months, I got back up to 3 pills a week. And then I just kind of hung out there for a while. And I don't know the exact time frame, but I've only, I can tell you that in May, right now, I've been on it for 1 year. And honestly, right now, I'm doing great. I'm up to, I've in the last, I've been on 4 pills a week now for about a month, about 2 months now. And I've been having no adverse side effects. I really think that the anxiety I was feeling was either external to the drug or my own internal paranoia. I think it just took me a while to get used to the fact that, hey, I'm going to be all right.
Yeah.
And
we don't know for sure, but I can tell you that from a person who has suffered stress and anxiety from other issues, I have PTSD from the World Trade Center, and I've been through some shit in my life. My brother's death, and just all kinds of stuff.
Yeah, I've listened to your story about your brother. That's really interesting.
Yeah, and so
unfortunate too.
Well, thank you. I understand what it's like to deal with anxiety and stress, and I had anxiety over my hair, obviously, and depression and all that stuff. And once your mind is set in motion, you can actually have, whether it's the side effects that you're concerned about from finasteride or anything else. I mean, you could be concentrating on, people that suffer from hysterical blindness. I mean, the mind-body connection is extremely real. So,
right.
And especially when you're talking about somebody's dick and you're talking about, you read the list of stuff that people are talking about online, it's very, very possible that you're going to be dealing with brain fog, you're going to be dealing with anxiety, you're going to be dealing with guys are claiming that their facial skin is aging from minoxidil, all kinds of stuff, and it just perpetuates into this really nasty, just unfortunate, in some cases, psychosomatic situations.
Mm-hmm. Yeah, I think I was dealing with some of that, and so I just wanted to say, for anybody out there that's thinking about taking it or is thinks that they're experiencing side effects, that I don't know, I guess they call it like the nocebo effect, or I'm not sure if I'm saying that.
No, that's correct.
That is very real. It's very real. Like it can definitely it can get in your head, for sure. And I feel like I just, I obviously I'm cautious about it. Otherwise, I would take it every day, regardless.
Sure.
But so far, things have been well, and I haven't noticed any decrease in sexual libido. There's definitely been times where I'm like, oh my God, can I get a boner right now? The type of thing. Yeah. And it's happened. You know what I mean? Like I'm fine.
And there are going to be times that if you think that, it's not going to happen because your adrenaline kicks in even slightly. You can't get a hard on. It's performance anxiety. I mean, people have it without the drug.
Yeah, exactly. And I mean, honestly, I haven't really even had that, to be honest with you. Maybe I'm oversharing here, but I hit a record the other day for 8 times in one day.
Wow.
Because I was gone. And granted, I'm 34 and a half, so I'm younger to some people, but maybe some people I'm older. But I was gone for like a week, and I came back, and the mood was right, and the wife was interested, and that type of thing, and it was great. And I was like, I surprised myself. It was just, it was a low pressure situation, and
so it wasn't like a hooker crawl. It was actually with one person.
Yeah. I've been married for since I was I've been together with my wife since I was 16. So.
Oh wow! Can I think if it was different women? It's a good possibility on a good day if I have enough caffeine, maybe I can do 8.
Yeah. No, you get excited. Yeah. No, I feel you, Spencer, man. Yeah. No, I just. Well,
with any luck, both of you guys can get that number up. Good luck. What? I'm sorry. Did I say too much?
Anyway, so I just want to say that my hair has been looking pretty good. Like I haven't been losing too much from the front, and that's never really been my spot. It's always been from the crown, but it's looking pretty good even on just a little bit that I've been doing. So in 1 year, I'm only. I'm halfway through my 4th prescription, which, for those of you that don't know, for each prescription of Propecia or finasteride you get, it's 30 pills.
Right.
So I'm only at 3.5 prescriptions here, and I could probably regrow more hair, I'm guessing, but I'm just being cautious about it, and I also use like a concealer, that you guys talked about before, and honestly, like when I put that in, like you really can't even tell. I
am currently wearing a disguise. That's how I live my life, man.
Yeah, and it works really well. And I would highly recommend those concealers to anybody that's going through it. Because it really does. It works well if you do it right, and the more you practice at it, the better you get, that type of thing. But anyway, I do have a picture that I could send you guys just to show you where I'm at, and I don't mind if you guys share it or whatever.
So you mean we could put it on? We can put it online, like Carl's?
Yeah.
All right.
Absolutely. And I kind of tried to do I have the email written up right now. I just need to know where I need to send it to, and you guys can use it for whatever. I don't care.
You can send it to admin@hairtransplantmentor.com. Put in the subject line Morgan from Oregon.
Okay.
And I'll forward that on to the relevant individuals.
Okay.
And I just want to be clear that the images that were provided, that were shown, are images that were signed off on and allowed to be put online.
Yes, absolutely.
You know, but I'm saying as far as the images that we showed today. So what we ask for is, if it's, sometimes we will take it from another website, and then we will ask the person who has the website for permission to show images. In your case, you would just have to write a little email to Joe saying that, we have permission.
Okay, I'm just going to add at the top of this email saying that you guys have permission.
Yeah.
Go and
And essentially what we're going to do is, it's just like, this is a radio show. So anytime somebody calls in, we actually should have some sort of a thing, Joe, where if you get an image, someone sends you images, that they get like automatic permission to put them on the show.
Yeah, I can do that. Or, there'd be a process, set up a special link if you want us to use. Yeah, automatic. Yeah, could
Absolutely.
do that. Yeah.
All right, man. Well, listen, I'm first of all, I'm really glad that you're doing well. I'm glad that you've gotten over the nocebo effect and the possible side effects that you were dealing with, and that you're growing a lot of hair back. That's empowering.
Yeah.
Yeah. No, I just want. Yeah, it's you never it's few and far between that you hear success stories. So, I just wanted to be promote that and give you guys a drop in and say thank you for encouraging me to stick with it, because so far, I'm telling you what, dude, if my dick didn't work, I'd be screaming it from the top of the mountain, and you guys would be the first guys I'd be yelling at. But so far, it's great, and I don't have any problems. I don't that I notice. I don't notice any decrease in libido or anything like that. I just really don't. And everybody's different, though. You know what I mean? So, I'll be cautious about it, but don't be scared shitless to try it out either.
All right, man. Well, listen, I really appreciate you taking the time to give these other young guys advice, because there's a lot of guys out there who are so shit scared that they will never have the opportunity to potentially keep their hair for a very long period of time. And they are, a lot of guys wait so long and then they get on it and they're like, oh, man, I wish I would have done this 5 years ago.
Right.
So.
Yeah. And it's definitely, you only got so much time, so, if you're fading, you might consider it, you might consider it. And I would definitely recommend the way that Joe recommends getting on it, which is, start it off slow, man, do one a week. See how that treats you, and see what your mental state feels like after that. Are you worried about it? That type of thing. Just really check in with yourself while you're doing it. And that's about the best advice I could give. But I thank Joe for that advice, because it's really changed my life, honestly.
Well, man, listen,
glad it worked out.
Thanks so much for the call. Glad it worked out. We'll talk to you soon.
All right, thanks, guys.
All right, man, take care.
Take care.
Mm-hmm.
One more call, Joe?
Yeah, we started late, so why not?
Hey, man, you're on the air. Who's this and where are you calling from?
Hey, this is James from Texas.
James from Texas. What's happening, man?
Who?
Hey, not much. James, one of the many James that calls.
I got to ask you something.
Common name.
I got to ask you something, James. Every time you call in, after the show is archived and I move it to the proper playlist, about a day later, there's a comment in the comment section. It says James from Texas and then a timestamp. Is that you?
I don't know. I'm not sure.
Well, you should know. Are you actually? What do you mean you don't know? Are you typing in the comment section, typing James from Texas and a timestamp?
There may be. That might be me.
Maybe.
It's because these you forget the questions that are asked, and everybody has their own specific question, and then that's my way of getting
Reminding
back to
yourself.
it, I guess you could say. Yeah.
Oh, okay.
Like
Okay, that's cool.
Yeah. Yeah.
No, that's actually pretty cool. But the reason, I mean, the reason I was asking is because no one else is doing that. I thought it was kind of out of nowhere, but it reminds me. It's like I would love to be able to keep timestamps of the different sections where we change subject or a different caller calls in, but I'm too busy, with other things to write down the notes. And I'm not going to go back through the show, which is almost always 2 hours long, and jump through and find. It's like that is such a pain in the ass. So at least we got one, and you know where it is. So thank you for doing that.
Yeah. Yeah. No, actually, I noticed that in your older videos. I think you had that, but yeah, that.
Yeah, I would do that, but again, it just took way too much time. Way too much time.
No, I understand. And yeah, like I said, that was pretty much for for my own documentation to go back. Oh, okay, someone called on this. James called on this show, and so that's what that was about.
Right on. Very cool. So what's going on? What can I help you with?
Not much. I love hearing the success stories for those who are on medication, and I think last week I talked about how I'm on medication, and I was hoping that maybe you can look at the pictures that I had sent you, and I didn't call this past Tuesday, but just like the previous caller, and you can also use mine if you decide to use it, but not that mine's a success story, but mine's more so to show you like the degree, the severity of my hair loss, which was that Norwood 7 pattern, because actually, like now, I'm about a month and a half on dutasteride, and maybe 5 months on finasteride, 1 milligram a day, and I'm just kind of curious to get both of your opinion if you did see the pictures, if there's potential for me to see any success just based on the time that I have been on it and the pictures.
How long have you been on it?
Finasteride 5 months every day, and dutasteride 0.5 milligrams for about a month and a half now.
Yeah, I'd forward these photos on to Spencer as well, and yeah, like where are you asking about where the potential is for the corners, the hairline, or are you talking about the crown or everything?
Just in general. I mean, what do you? I mean, just because it's diffuse, so it's different than from the typical pattern, I guess you can say, where the receding hairline, and because mine.
Yeah, and you know what you represent one of the patterns I talked about in one of my videos where I'm talking about the typical Norwood patterns of hair loss. You represent a very common pattern that is not documented, where your hairline is starting to recede a little bit. You got it's actually just turning to a mature hairline, but your crown is really thin, and it's a large area of your crown. It's the entire crown, but the top of your scalp looks like it's still pretty full. And this is a normal pattern found in a lot of guys. But with your degree of loss, it's hard to look at someone and say, yeah, there's potential for a big turnaround, or to say anything more than that. But keep in mind, when we say that, we don't really know, because it's a crapshoot, really. I mean, statistically, you do have a good chance, just based on the numbers in history. But for you specifically, it's hard to say. I mean, just all we can do is say, yeah, there's good potential based on the history of the medication. The good thing is you're not bald, you're just thin, so there's a lot of hair there to potentially grab onto and thicken up into a stronger anagen phase.
Yeah, that's one thing that I've noticed as well. But I've always wondered if because of my type of hair loss, I wonder if it's more on the aggressive side, like there is. I'm starting to kind of accept, or not necessarily accept, but just face the reality that I may not be a good responder, just because by now I would have seen some good improvement just based on what others have seen, usually 3 or 4 months in, and I just went on.
You can't you really can't judge your response rate or how well or poorly you're responding to the drug based on other experiences. There are averages, but I also have known guys who have not seen anything that was positive for a year and a half. So, you know, you got to give it time. If you're not having any real adverse side effects, then give it time and try not to. I know it's hard not to worry about it, but try not to worry about it. I remember, Joe, I don't have the pictures in front of me, but I remember your pictures. Joe sent them to me the other day. And, you know, I mean, there is some hair loss. Is it significant? I mean, it's there, but you wear your hair really short. So right now you probably look pretty good as far as, you know, if you were to show your face, your full face. Yeah. So, you know, it's very possible that you can save that, and you may not recognize that for another 3, 4, 5 months.
Right.
Yeah. I mean, I'm just kind of, you know, like you said, trying to be patient, but at the same time, it's like, I think that by now, you know, coming close to 6 months, I guess you could say, on finasteride, that, you know, I think one may know by then. And I'm the reality's starting to set in a little bit, and I'm just kind of like started thinking of what's next, I guess you can say, because I know that it helps the majority of people, but hey, what if I'm the minority that it doesn't help, and so on?
Well, what's next is, you know, sometimes you have to make a decision. Are you willing to give up the fight? Because what is next is could be years of self-torture, you know, dealing with trying every treatment under the sun, and then eventually deciding to have a hair transplant. You know, my whole thing is, you know, if you can shave your head, because you seem to wear it really short right now, if it's possible for you to shave your head and really give it a college try, do that while you're treating your hair loss now. And actually, when it grows out, you might all of a sudden notice that finasteride is actually working. But if there's a small possibility of you doing that, I mean, even something in the back of your mind saying, I might be able to deal with that, try it.
Yeah. That's the thing. You got a super short haircut now, so give it a shot. What can it hurt? It'll grow back.
Yeah.
You know?
Yeah. Just so based on your experiences, I'm sure you've seen hundreds of people who have gone through, I guess, hair loss and medication and transplants. Just where do I fit in that scale, I guess you can say, as far as like success or potential? No. Okay.
Oh, sorry. So I thought you were talking about the Norwood scale. Finish your question again, or repeat it. Where do you fit on the scale of success?
Just based on like what you have seen throughout your experiences, you know, like you work with doctors, and you've seen people on medication. Just from what you've seen patients before and after, what do you think that I may fall, or just like am I just too severe to be helped, or based on my situation?
Not at all, dude.
No,
you're not severe. You are like mid-range. The severity is still, I mean, you still got enough hair for coverage and to essentially frame your face, even though it seems like you have maybe a slight, just based on my memory, and I'm getting old, maybe a little bit more recession on one side than the other, which is normal. Mm-hmm. No, you're not beyond help. Don't even think that. This drug might be able to help you. And then there's always going down, you know, a stronger route if you want to continue the fight. But I honestly believe, you know, if shaving my head was a real option back in 1987, where I wouldn't have been characterized as a white supremacist or, you know, a neo-Nazi,
or look like Kane from Kung Fu,
or look like Kane from Kung Fu, which is what would have happened. But I probably, even if I looked like Kane from Kung Fu, I probably would have considered it, especially during a certain period of my life when I was really depressed about hair loss. But you're talking about the 80s. Hair was everything, man. It was everything back then. There was nobody, unless you were Yul Brynner, who was already old, or, you know, Kojak, Telly Savalas, or a couple of brothers out there that were shaving their heads, and not even athletes. It just didn't exist.
Yeah.
Yeah. I'll be honest with you. I've shaved my head before, and yeah, like I've been very emotional over it, and I told myself I was going to accept it, but I'm actually not willing to give up quite just yet. I think that if anything before that, maybe transplants. I know that that there's negative.
Dude, listen to me, man. Listen to me. You're emotional about it. You're emotional right now. What you might want to do is take face-forward pictures, if you feel comfortable, of yourself with the hair that you have right now. Shave your head. Take those images. Do side by side. Show them to us. If you're willing to put it out there, we can block out your eyes. Show it to the community. You might be surprised at how good you look. Listen, we're all very critical of ourselves. I have people guys who have been in radio for years, who are like, man, you are so good at what you do. You have such a mellifluous voice compared to some of these, heavy, kind of like always on radio type of guys. It's a real asset to what you do. And sometimes, especially at the beginning of my career, I used to be very critical of myself, whether it was my, the way that I communicated compared to some of the big radio guys out there, or even my writing, whatever, and my appearance. I mean, that's just the way we are as human beings.
Mm-hmm.
And then you start to realize, like when someone, you become a best-selling author, or, you write for a major publication, and they're like, man, you should be doing this full time, or, guys who have been in radio for 30 years saying that you have very unique and really compelling pipes. You start to realize that your judgment may not be, and your critique of yourself may not be logical. It's not objective. You know what I mean?
Yeah. No, yeah, I understand. And like I said before, people who have known me, they have no idea that I'm going through hair loss, because it's the untrained eye, right? The majority of, a lot of, I don't want to say the majority, but a lot of people have no idea how to recognize hair loss, which is kind of sad, because had I known years ago, I would have been on it. But looking back at some old pictures when I was 23 years old, I'm 28 now, so you're talking 5 years. Had I known back then, I would have had 5 years worth of effort to maintain or try to prevent.
And sadly, the internet fucked you up.
Yeah.
And if I remember correctly, we got to take a call in a second. You're still on these fucking going on people's, channels, and still watching all this bullshit, and still, and again, I can't blame you. I understand it, because, you really want to help yourself, and you're really upset about your hair loss, but, you're going to be swayed by influencers as opposed to experts in this field. And I know that you come to us kind of after the fact, after you see all the nonsense out there. But dude, I'm telling you, in your situation, I saw your head. You don't want to get a hair transplant, man. You do not want to fucking get a hair transplant. You could be really fucked up. You're not a candidate, in my view.
Mm-hmm. You're saying that because why? Because of the I'm not there yet, or just because in general?
You're definitely not there yet.
Severe.
You're not there yet. I have to see what your hair looks like when it's grown out. Yeah, they could shore up your hairline, but what happens if you start to lose hair rapidly behind that?
Mm-hmm.
And you're going to be playing constant catch up, and then you're going to be spending. I mean, I don't know if you're rich. If you're rich, then you got the money to spend, then fuck it. But even take the money aside, the emotional roller coaster.
Yeah.
Of going through that.
And just to add on to what you just said about the influencers, you're actually one of the few, actually, that I started to watch at first. And I will be completely honest that I had my doubts. I didn't trust the show, the program, just because, just back then, whenever you were first a newer user or hair loss sufferer, you hear about the medication, and then instantly you see the the post-finasteride syndrome and all this all these rumors and in my head, just like everyone else, oh, this guy is for sure with Merck, and he's promoting whatever he's going to say, what he has to say to get his.
But that actually shows, and I understand that, but that shows naivete of young people today, and how advertising and big pharma would work. I would not legally be able to talk about my experience or product, about this product or service, or promote it in any way without that being, you guys being notified. Merck would get, it would be really bad for the pharmaceutical company. You can't do it.
And in fact, that's one of the problems with some of these influencers is they're not disclosing that they are getting reimbursed, or they're sponsored, or that they're getting some sort of kickback from any of the products that they're talking about.
Well, but that's the ethical issue, and yeah, there could be some legal issues with it. But when you're dealing with, when you're really dealing with a company like a top, a Fortune 400 company, like pharmaceutical company, everything, every dot and every T has to be crossed. I mean, I've dealt with these guys. When I was first on the radio, they were sponsors of my program in a big way, both major pharmaceutical companies. I was the first weekend program to ever have pharmaceutical companies sponsoring their show across the country. And I laugh because it's like, I would take their money today in a fucking second. That drug saved my life, but they don't do direct to consumer anymore. That's the way that it is. So I understand your point. We're going to actually have to go because we have Jay, do you want to stay on for a little bit?
Yeah.
Okay. We have some calls on the line, but dude, I appreciate your candor. I'm glad that you finally found your way back to realizing that we're out there trying to tell the truth. That's what we do. That's our gig.
Yeah. I just want to be clear that just at first, that's how I felt. But then later, as I continued, I realized that you guys are the truth. You actually practice what you preach, and you're actually the go-to. And I put you above everyone else. So I just wanted to be clear about that.
Well,
a little comment I made.
No, I really appreciate that, man. Listen, good luck. You're not beyond help. I do believe that you may be pleasantly surprised in a few months, but do not jump into surgery, man. Dude, you will be very unhappy at this point. 5 years down the line, maybe not.
Okay. Well, time will tell.
But give the medication time to do what it's going to do, okay?
Okay. All right.
All right, man.
Look forward to it.
Take care.
Yes. I appreciate it.
All right. Thanks for calling.
All right.
Good night.
Joe, we're dropping in the line, so if you want to take care of that. All right, take care. The phone number, 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this, and where are you calling from? Hey, man, you're on the air. Dude, I could hear myself in the background. You were on the air. Who's this?
Hello?
I'm going to give you like 3 seconds. Can you hear us? All right, dude. Thanks for the call. Hey.
Yeah, this is Alex. Hello?
Yeah, hi. Yeah, you're on the air.
Yeah, quick question. This is Alex from San Diego. I called actually like 5 or 6 months ago.
Okay, welcome.
And how's it going, guys? Happy Friday.
Happy Friday.
How you doing, man?
I'm doing good right now. I'm currently on ProScar, so 1.25, cutting in fourth though, and it's still kind of thinning on the top right now. And I've been looking at Vitascal or Nutrifoil as far as to supplement that or something like that, maybe like an add-on or something.
Well, I will tell you. I'll tell you that both of these companies and Nutrifoil, I can't never pronounce them right, but they have gotten the men's wellness supplement companies now that are really focusing on hair, getting a lot. They're getting a lot of venture capital, getting a lot of backing. They're getting a lot of. They're getting a lot of press. I am not going to say that this stuff is snake oil or it does not work. I don't have the data. But I will say that in general, anything that has to be sold as a nutritional supplement for hair loss probably won't do the job that you expect it to do. Now, Again, nothing against this particular company, and I could be completely wrong. I mean, I could find out, and I could be proven where, you know, I get calls from 1,000 guys who have really been helped by this.
Oh, no way.
No, I'm saying I can. I mean, that could possibly happen, but you know, at this point, I just think, you know, we are just in a new generation of products that are being sold to treat hair loss. Listen, when I started in this industry, I think it was around 1997 or 96 or 97, the FTC, Federal Trade Commission, I think maybe the FDA as well, they basically started to crack down on all of these guys who were advertising and making hair loss claims on television and in newspapers and stuff like that. There were companies like the Helsinki Formula and stuff like that, which is way before your time. That was heavily advertised on television. They stopped allowing that to happen. And then over the years, it seems like these laws became a little bit more lax. And, you know, it just appears that there have been more and more people taking greater and greater risks as far as making claims, or they've been using semantics to kind of get around the claims, to kind of make you believe, like, you know, they use terms like promotes fuller, thicker looking hair and shit like that. And just by the use of their language, they're able to kind of skirt these issues of dealing with the law. So, you know, listen, until it's proven, I can't tell you to go out and get anything else. Do I think these products are going to harm you? Probably not.
Right. I mean, this is like for the early stages of like super like early stages of like thinning or something. You know, it's just trying to add on maybe something a little healthier. I've just been looking at that, and it seems pretty good, convincing, but, you know, just want to run it through you guys.
They all seem very convincing. I was convinced. I bought everything, dude. I fucking hung upside down, put cayenne pepper in my hair. I bought every product known to man that was being sold in the back of the muscle magazines that I was looking like Joe Weider's magazines. And I bought it all, dude. And the x-ray glasses. I mean, but Joe knows what I'm talking about. That's old school.
Yes.
But you know, nothing has changed.
Right.
The ingredients have changed. You know, listen, I wrote the book on these natural DHT inhibitors, and I was a believer for a long time. And sadly, that book then prompted a lot of companies to sell saw palmetto and Pygium africanum, stinging nettle, and different combinations, claiming that it lowers DHT and it could be used for hair loss. That was a mistake on my part, because, you know, I was basing my references from a JAMA article that was written for people with benign prostate hyperplasia. There was a study done showing that saw palmetto, Pygium africanum, and stinging nettle did in fact lower DHT and helped shrink people's prostates. So it was extrapolated by some doctors and myself that this could help with hair loss as well. Wrote that chapter, and then these companies were off to the races.
Oh, wow.
So, you know, right now when people ask me about saw palmetto and other things, saying, oh, this is a natural alternative, it doesn't cause sexual side effects, that's not true. Depending on the dosage, these products that contain these herbs can cause adverse sexual side effects. The only difference,
I know people that's had it.
And the only difference is we have no clue exactly what you're getting into your system, because most of the nutritional supplement industry is completely unregulated, and there's only a small portion who actually will go the extra mile to prove that what's on their label is in their product.
Yeah.
So
interesting.
Just be careful, dude. I'm not telling you not to buy anything. I'm not saying anything out there. I'm not saying the products you mentioned are snake oil, but just because you see a doctor promoting it on television, I know there's a product called Viviscal. There's a doctor that you'll see, a well-known doctor you see promoting it on television, and it doesn't mean that it works, dude. It doesn't mean that it doesn't work, but it also doesn't mean that it works. You have to really delve into it, and you can't get that information online, because everything online is just such a mixed bag of false bullshit and, you know, and phony reviews, either good or bad.
Got it. No. I was just trying to find another approach instead of like raising the dose or something, like going like maybe go to another area, try this and
You could try it. You can come back to me and say, dude, listen, I got to tell you, this shit works. And then we file that away. That's out there for public consumption so other people can hear it. And then that's great. I would love to. Listen, if you find something that actually helps you, you come on the program, you tell us about it.
Please.
Yeah, we'll totally do it. I just kind of want to run it to you guys and see. But yeah.
Listen, I'm just trying to be. You got to be devil's advocate in this industry, and I'm just trying to let you know. Listen, if you are okay with spending some extra money, giving something a real college try, then give it a shot, man.
This is 1930. Give it
I
a try.
It seems like it has a lot of other benefits just to your health in general, like vitamin D and all these other things that can
take a vitamin. Take a multivitamin.
Yeah.
Why don't you go sit in the sun for 10 minutes a day?
Yeah. Don't eat potato chips and drink soda.
Totally, right?
Seriously. It's like just eat well and eat foods that have the vitamins you need, and you're good.
Yeah, that's what I'm doing now, and it's not working.
Yeah, well,
no, that's pretty much it. That's just I had one little question to ask you guys to maybe like improve the show a little bit.
You're going to improve this show? How dare you? Yeah, go ahead.
What about having like Doc Fridays? Like special Doc Fridays, like where you just have like a third Skype person, you know what I'm saying? Like someone from your member that you guys have on there, and just put them in your Skype or something.
Really, too much work. Too much work, dude.
Too much work.
No, we can do something like that. I was actually, considering we're really going to be working a lot. I have this big conference that I have to kind of prepare for, but after the conference, we're going to be doing a lot more undercover doc segments with different docs who are willing to go undercover. I got a voice changer and all that stuff. It's going to be pretty cool. That may be something that I would want to do live.
Or transplant of the week. You know what I'm saying? Like where you can just have like people's vote. Like, whoa, this guy from Turkey or wherever.
Yeah, you know what? I don't want to hurt anybody's feelings, dude. People. It's kind of like rate me hot or not, and all these people are like they're fucking devastated when people like vote them down. I don't want people to send their transplant pictures to us, and they may be kind of happy or even questioning, but they're not devastated, and then all you motherfuckers destroy their lives.
Yeah.
But I understand. I understand where you're going, and we will start to evolve things.
But and this is the problem with forums, like someone sharing their results saying, "Hey, look at me," and then you got some asshole that's everyone's anonymous behind their keyboard. Some asshole's like, "Yeah, that looks like shit, man. You should shave it off." It's like
right.
It's I've seen the effects of that, man. It is brutal.
It's brutal. And I'm going to give you one piece of advice also when you're considering adding anything to your regime. If something is called a nutraceutical, I would say move on.
Move on.
And that's just my opinion, based on my opinion, and based on my opinion.
Yeah.
All right, man. Listen, good luck. Thanks for the suggestions.
Hey, thank you guys for everything. Keep doing what you're doing. You guys are awesome, too.
Thank you, man.
Thanks, buddy.
Thanks.
Happy Friday.
Joe tries his best. All right, take care. Bye.
This message brought to you by Merck Pharmaceuticals.
Nutraceutical. I love that term. You know how many companies, the nutraceutical companies, have approached me who want to pay me just to slap the American Hair Loss Association seal on their product?
A lot.
4, actually. But that's still a lot.
That's a lot.
Yeah.
Yeah. 4 more than anyone else.
Yeah. We'll take this call. Hey, you're on the air. Who's this, and where are you calling from?
Hey, guys.
Hey.
Hey, Dr. Cole.
Dr. Cole, how are you, man?
Yeah, man. Let me tell you what. I'm doing a lot better than Tesla. Just thinking.
Well, we've known that for a long time. Actually, I was I don't like to talk about investments or anything like that, but everybody, all of my peers, they're all like, they thought that this was going to be the greatest thing since sliced bread. I'm just like, they can't even seem to get their product out on time. You know, and this was 2.5 years ago. Like, something is rotten in Denmark, man.
Well, anytime you go from a Model 6 to a Model 3, you got to expect you're going down.
Yeah.
Right?
Yeah. So, all right, so what's going on?
Well, let me tell you what. You know, I got to say, we got a great conference coming up in Manchester.
I'm excited about it.
Joe's be there.
Mm-hmm.
Yeah.
I'm excited about it. And, you know, what we're going to do is, and guys, anybody who's actually watching the broadcast, we're going to be doing, I mean, there's obviously a time difference. The guys who are in the UK and Europe will be able to see whatever stuff that we do live. Obviously, it will be live for them. But we're going to do a lot of tape delay stuff. We're going to put it out on the live feed so that you guys can kind of be a part of things. And, yeah, you don't have to sit there and watch the whole conference or every interview, but at least it's going to be available to the consumer when these things were never really made available to consumers before.
That's right. And you know what else we may have the first live demonstration of exosomes. I'm working on that now. I'm not going to mention the company yet, but it's going to be pretty cool.
So
very good.
So why don't you explain? I want you to explain to these guys what you're talking about and how it works.
Well, okay. You know, the big cocktail today is adipose stem cells or stromal vascular fraction, amniotic membrane. You know, you got A cell mixed in there somewhere. You got cytokine-rich plasma, platelet-rich plasma, and the new thing that's about to hit is exosomes. Now, this is derived from the amniotic fluid of a pregnant female, and they boil it down, and I mean they can tailor it any way you want it. But you know, we're hoping to go live with the latest and greatest in regenerative medicine. We're definitely going to have amniotic membrane, a stromal vascular fraction, follicle stem cells, and PRP. So hopefully exosomes.
Well, you know, listen, I mean, the science of regenerative medicine is really what's exciting. You know, like you wrote in the chat, you know, it's finasteride, everything that actually works is a form of anti-aging medicine.
Absolutely.
Oh, 100%.
Yeah.
All hair loss is accelerated aging.
Right. And
yeah, so, yeah, we're trying to put a stub in that nose, and you know, if we can ever figure a way to turn it around the other way, you know, where you actually grow it back, that'd be the real cool thing.
Well, listen, it'll be the real cool thing, and transplants would become obsolete. And the fact of the matter is, the guys that start to do this now, who really take it seriously, who aren't just going to jump on the bandwagon and then, you know, start selling questionable, you know, possibly not correctly, you know, tailored products. I don't even know how to say that, but, you know, products that don't work. And they're just going to jump on this bandwagon because just like everyone now is saying, claiming that they're doing stem cell hair transplants, it's all bullshit. The industry has now come to a point, and you've been in it for a long time, Dr. Cole. There's been a lot of bullshit forever, but now it is worse than ever. The stuff that we're seeing, the way that we're seeing people advertise on Instagram, Facebook, on, you know, through Google, everywhere else, and the you know, stem cell hair transplants, or the, you know, however, you know, what is it called? Ice hair transplants, Joe?
Yes. Ice transplants, sapphire FUE.
Sapphire FUE.
Yeah, all that horse shit.
There's so much confusion in the market now.
Yeah, well, you slap a name on it, you got something, right?
Yeah.
But really, the Holy Grail's not there yet. We can't turn that follicle on. Once you're bald, and we don't know how to turn it back on. But the more stuff we throw at it, who knows? We might get there one day.
Well, listen, it's exciting, and I'm really excited about the meeting, not just because, you know, because I'm going to be there and I'm going to be broadcasting, but I'm excited that, you know, a bunch of like-minded people are getting together who really are interested in moving this field forward. The real pioneers of FUE are going to be there. This may not be a meeting that is necessarily sanctioned by the politicians of this field, but it is I think we are on the cusp of tremendous change in this field, and this is change in the right direction. And I'm excited to be on the ground floor of it and to be a big part of it.
Absolutely.
Yeah, and nice thing is we're going to have a lot of young doctors there and give them the opportunity to jump on board and spread your message, which is, we have to find a way to direct patients to good quality surgeons, and there are multiple good quality surgeons. We have to find a way, and that's what you and Joe have been really pounding the pavement on for the last 8 months, 9 months. Actually longer, I know that, but you really have put the pedal to the metal the last 8-9 months, and I couldn't be more proud of you guys.
Well, I appreciate that, and I love the fact that we have this relationship and that, you support, obviously, we support what you guys are doing, you support what we're doing. We figure that, collaborating and really working towards this common goal is the only way to affect change. My hope is that once this meeting, when the politicians see the success of this meeting and what's going to transpire after the meeting, they're going to say to themselves, you know what? Fuck, man. A, if we want to stay relevant, we have to come on board. B, it really is, after seeing everything and kind of seeing the reaction from the consumer and the physicians who are attending, maybe they are going in the right direction. And maybe we're going in the wrong direction. I just wish more guys had the humility to say, okay, these guys aren't doctors, but, they're kind of helping us, helping things move in the right direction. So
you're an essential part, honestly.
Well, I appreciate that, Doc. Listen, we've been on for almost 3 hours. We're going to kind of call it a night. Joe, do you want to take one more call or no? You said you're waiting for a call. I don't know.
Sure.
Okay. Doctor,
sure, let's do one.
Dr. John Cole, thank you so much for calling in.
Man.
All right, always a
Thanks
pleasure.
for calling, Doc. Always good to hear from you.
And just remember, Friday afternoon is open to the public.
That's we're going to be promoting it more.
Yeah.
All
right. Just
I'll
make
take
sure
care.
we have good
Bye-bye.
security. Okay. Take care.
Yeah, that's the big thing.
Bye.
Bye-bye.
888-659-3727. Hey, man, you're on the air. Who's this, and where are you calling from?
Lewis from South Florida.
Lewis, what's happening, man?
What's going on, guys? I called in a couple of months ago, and I had a wonderful conversation with you guys, and I'm telling you, you guys are still doing a great job. I'm one of these old guys that got into this hair transplant thing back in the 80s.
I remember you, Lewis. I remember.
Yep.
I remember I'm the one that had to drop out of veterinary school for 1 year.
Yeah, that's right. That's right.
My transplant was coming in with Dr. Resnick.
Jesus.
Back here in South Florida. But I was listening to your show tonight, very entertaining. And I just had a couple of comments.
Sure.
Just because I think, again, anybody out there, these guys are the place to come for real, truthful information in a field that's like completely, you don't know where to turn to because there's so many things that are said and that are not reality, that these two guys have a ton of experience and have been through it. And you do see these young guys on YouTube and things like that, these influencers that really haven't been through it. Because
right.
The hair transplant business is you really have to have a long period of being in it to understand it. One of my first points that I wanted to speak with is that when people say, well, did you have a good hair transplant? That really, to me, varies with time. Because even with me, I had my first hair transplant, and this is the plugs, in 86. And after the first period where it started to grow in and I freaked out and I had to like go away and wait till my second hair transplant came in because it was on the front hairline. It really looked odd back in those days, when they used to put like an inch apart the plugs and then they would grow in. I mean, people could pick them out from way far.
Oh, yeah.
But, once they grew in, once I had my second hair transplant and I had a lot of hair. I just was, maybe a 2 on Norwood. If you asked me like 2 years after my surgeries, I would say I was happy because I could kind of comb it with my other hair, and you couldn't see the hairline, and so it looked okay. But as the years progressed, and I think Joe may have gone through this, you know, if you ask me,
Joe's gone through everything.
If you asked me 15 years after I had that hair transplant, would I have done, you know, was I satisfied? The answer was absolutely not.
Of course.
Well, well, first of all, I mean, that's an incredible point that I hope is something that is not lost on these young guys. Now, with today's state-of-the-art methods, a hair transplant, a single session, should be a standalone session, meaning that even if you lose hair behind your hairline, even if you're, you know, really progressed significantly, that at least the hair that you have on your head is going to look natural and is going to be placed in a natural pattern so that, you know, you can comb it, it can be combed back. It may not be, you know, where it doesn't look like it has to just blend in with your hair, but that it could essentially stand alone. That wasn't available back in the day. However, we're kind of going back to where we were in the, I would say, the mid-90s, at least, when it with mini and micros grafts, not talking about plugs. And what I really fear for these young guys who are getting these aggressive hairlines, or even just getting, you know, these turnkey device procedures done at a young age. These grafts are 2 hairs, 3 hair grafts in the hairline. They may be blending in now, but as they progress, it is going to be like back in your day, you know? I mean, and they're going to be progressing faster. They're going to be seeing these things. And when I say faster, if a guy's young and he's starting to lose his hair at a young age and has a hair transplant at a young age, in general, they're progressing faster than someone who waits and starts at an older age. Yeah. So it's very possible that they're going to see the negative effects of what they're doing to themselves within 5 years, 2 to 3 years, something like that.
And even, and though I agree with 99% of what you said there, Spencer, here's my point. My dad, you know, I made that joke that my dad was a Norwood 8 when they asked me what scale he was in, because my doctor never asked me what my family history was or anything. If I was to transplant myself and be 26 again now in 2019 and go in and have a transplant, you know, a modern transplant, if I progressed to where my father is, even with the techniques that are available now, I mean, because this guy, my dad was like, you know, Fred Mertz from the I Love Lucy.
Sure.
So even if you've got what looks to be natural amount of hair on the top, it's just not going to look natural because there's just no way you can cover a good amount of that area. I mean, there are people, like if my dad...
Yeah, but if you look at Fred Mertz actually had somewhat of a hairline that he would comb back that was very, very thin. So they can create a standalone procedure that would end up looking like that if someone only had one procedure.
Right.
Whereas in your day, that was impossible.
Impossible.
Yeah.
But what I'm saying is that even with the technology you have now, you still have to be worried that young people are coming through. And when I say young, in my experience in hair transplant, anybody under 35, because before that time, even with the medications, because the medication may work for a little while, and then it may just stop working. Who knows? And
I
you may
agree with
progress
that.
to who knows to where.
I
So
actually,
if a young
you know,
guy comes,
Joe's not a Joe. You know, based on his experience as well. I mean, his philosophy is a little bit. You know, he'll go a little younger. I've always believed that if you can hold off to 35, that is the time. That's a reasonable age to get a hair transplant. I think 30 could be a little young because as men, we're still not even formed by 30. I mean, I always had to work my ass off, and you know, I had to make a living for my family, and for, you know, I had a whole crazy upbringing. So I kind of maybe matured a little earlier than some guys, but in general, I hang out. I mean, I have a guy that runs the show from GFQ, great guy. What's Andrew going to be? 34, 35 years old?
About,
He's like a 15-year-old kid. He's got 2 kids.
Yeah.
You know? And that's just the way that it is. And that's how the normal 30-year-old is. And, you know, early 30s. They're still like young boys.
they're still like young boys, and at around 35, most people start to transfer into kind of a more adult, a more clear view of life. Not that it's just, I was kind of lynching that poor 28-year-old guy that was very emotional about his hair, the guy with the loss in his crown. I mean, he needs to go to a psychologist, first of all, to even get a grip, because no matter what you tell him in his emotional state, he's still thinking transplant, which is like the wrong thought to have. And
he may not. He may not. You're talking about was it James or
James?
Yeah, he may not listen to us. Guy from
James
Texas.
from Texas.
He may not listen to us. I mean, I do notice that every time I try to give him advice, I'm not saying he's not going to take the advice, but there is kind of like a rebuttal there, or well, what if? And that's the desperateness. That's the vulnerability talking. And
we both.
I get it.
Both been.
Yep.
I remember my sister telling me, when I started to say, well, this was a mistake, because at first when I first started to grow, I thought this was the worst thing I've ever done in my life, and I had to take a year off just to make the thing look somewhat natural. But then later on, I said, well, not so bad. But then, now I still think it's the worst thing that I've ever done. And my sister used to tell me, look, back in those days, you would have done anything to get that transplant done, because your mind was not thinking correctly. And when you're young, that's usually what's happening to you. And when you see people out there, and particularly the marketing they do now, which is basically aggressive marketing, you look at that marketing and you don't have a good sense of what the world is all about, you're going to think these people can help me and I can have a hair transplant no matter where I'm going to end up in the scale of Norwood and be successful. And that's not absolutely true.
It is actually almost 100% untrue.
Because
Most men who begin the balding process before the age of 25 will have significant hair loss. And, if they're not advised and they're not given all the tools they need to make an informed decision, then they will be sorely disappointed. I think there are cases where young men can make good candidates if they're willing to have a very, relatively high hairline placed, that they can grow into, that's going to be age appropriate, and that they're told everything that's going to happen.
Or might happen.
That might happen, right?
Because in my case, I mean, my dad is just my dad. Thank God, I'm more than 50 now. I'm closer to 60, but my dad by 45, he couldn't have a hair transplant because he was already Norwood 8.
Look,
I mean, it doesn't work.
Dude, all I can say is, and I tell these doctors this all the time, and I really believe this, it is very difficult to talk a young person out of surgery. So if someone sits, you have two choices. You give them everything you can, and then even ask if they're willing to have their parents come in, if they're under 25 years old or around 25, even though they're old enough to make their own decisions in most cases. But, just to get an objective opinion, provide them with all the information that they need. If the doctor believes that the patient can benefit and the patient is fully aware of everything, then okay, then that's fine. But that's rare. But in most cases, it's so difficult to talk anybody out of surgery. So telling them the truth, in my view, can only benefit a doctor. You're not going to lose the sale because you're telling them the truth.
Yep.
And
I understand that.
Yeah.
And the thing I worry about a little bit, thank God for the medications they have now, but I don't want people to young people to say, well, we got finasteride now. I'm not going to lose my hair because I'm going to start taking it and it's going to keep my hair. That's not necessarily true.
Right.
Well, the other problem that these young guys go through is they don't they don't they can't look into the future and understand. One of the most common things I hear from younger patients that are like the same age as James from Texas, I won't care what my hair loss is like when I'm 50 or when I'm 40. I want my hairline now so I can enjoy my 20s or whatever. dude, I'm going to be 50 this year. I still care what my hair looks like.
Of course you do.
Like everyone cares. I've had patients that are 80 years old that have had surgery because they care what their hair look like. We all care about what we look like on different levels. And so that's why I think that your story is incredibly important, because here you are after all these years and you're still in that boat where hair is an issue.
Yeah.
What's that?
Yeah, because I'm still messing with it, because I put in concealer, which is a pain in the ass. I wish I didn't have to do that. But if I didn't put concealer, and people would pick it out. I mean, just like probably, Joe, you did back in the end before you had Dr. Wong help you out. People can notice you have something weird on your head.
Oh,
it's
yeah.
not a comfortable feeling. So
getting people to look me in the eye when I was speaking to them was impossible. I mean, at first it would work, and then their eyeballs would always drift up to my hairline.
Yeah. Well, you're a pretty strong guy to keep going out there, because a lot of people would have withdrawn just because of that, because they, you feel kind of odd.
He didn't tell you about his alcohol problem, though.
Yeah, exactly. My black tar heroin problem, but. No, I mean, this is, I've talked about this a couple times on the show. I think maybe once or twice, and I've written about it, and I've certainly talked to patients about this when they've actually asked me point blank, how did you deal with it? And the fact of the matter is, when you go through something like what I've been through and what you've been through, you do one of two things. You either withdraw into hiding it no matter what, ball caps, concealer, whatever, wigs, some people will use, but you withdraw as a person from society. You're not as engaging with people as you normally would be if you didn't have this weight on your shoulder. The other end of the spectrum, which is where I went, is you try to you try to distract people with personality with personality plus, where you try to, I don't know if this was a conscious decision on my part. I don't think it was, but I was never in a position where I could do the ball caps. I was never in a position where I could do. It didn't really exist until well after my procedures with good-looking hair, GLH hair in a can, which I did use for a while. You remember the Ron Popeil infomercials, but
absolutely.
I was never in a position where I was allowed to hide my hair because of the jobs I was in. I was always bartending in restaurants where there's no hats, or eventually I went into office environments where you can't wear a hat. So I'll never forget.
Did you have a girl?
My very first office environment. I was in sales. Excuse me, got a bug in my throat. I was in sales in the computer industry back in the late '90s. And I'll never forget this guy. This guy was hired to come in the office, and he was a very seasoned salesman. And when you're in that kind of environment where there's a lot of pressure and it's a lot of quotas and stuff like that, it's very competitive, and you're always trying to one up your colleagues. There's no team in that environment. It's only out for yourself. And this guy walked in.
The company's actually getting incentive. The company's actually put programs together, so if you sell the most, you win something or whatever, and make it very.
Well, of course, yeah, of course, yeah. You best sales of the day for the sales floor, whatever. But this guy came in. He identified me as being one of the main people that he'd be competing against. I was the number 2 rep in the company at the time, and in front of God and everyone, he walks up to me, and the entire sales floor. He goes, "Hey, Joe, so I see you got some of them plugs in your hair.
Yeah.
How do I get some of those?" And this guy was full head of hair, like not even a Norwood 2. Like he had no hair loss, and he was in his late 50s, early 60s. But he zeroed in on that in front of everyone. It's like you could hear a record scratch, and everyone stopped, and you could hear a pin drop.
Yep.
And I've never wanted to hit a man that's twice my age, except for I wanted to punch that guy in the throat.
Yeah,
but at the same time, I felt like I'd just been kicked in the gut. And that's one of my stories from having to deal with that. And it was very, very tough. But
That's bad
Yeah,
enough. Did you have a girlfriend at that time or a wife?
yeah. I'd been married at one point, dealing with that issue, and it didn't get in the way of that. But all this was, I actually look back on this as being kind of like a boot camp for how to deal with people, a boot camp for how to deal with the public.
Right.
And like at this point, I have no problem talking to strangers, walking. This took me into door-to-door sales. Like I was able to do door-to-door sales and overcome that kind of issue as well. And I still had the hair issue. So it was a proving ground. It was a boot camp for me into how to deal with people and do so assertively, if that makes sense.
Yeah.
So I went the other direction. I kind of overcompensated to deal with my own insecurities.
Yeah, well, being in sales, you got to be in front of people. So you really had to overcompensate because you were in front of a lot of new people, and that most
Every
people
day.
can't do sales because they get embarrassed. Just talking to new people, they can't do it. So you must have really had a personality to go along with it because you get teased by guys, which is bad enough, but I don't care if I'm not going to be dating a guy or anything. That's nothing against people that like that. But my main thing was
not that there's anything wrong with that, as Seinfeld would say. Yeah.
Exactly. But my main thing in my 30s, mid 30s, I was still a bachelor and I'm still dating and everything like that. And even though I put out concealers, I remember I told you guys, I don't even remember the story, but I was on the beach. Spencer will probably relate. Know what I'm saying. Yeah, relate is that I was on the beach and some dude, just like happened to Joe here, said, "Hey, you got paint on your head." And this was in front of a bunch of girls and a bunch of guys, bikini in Florida, out at a tiki bar, and it's like, you want to kill the guy. But not so much kill the guy because he deserves it, but the worst part about it is that, you're afraid that it's very unattractive to women.
Sure.
Mm-hmm.
So, I think it helped a lot that you were, you had that, your woman part settled, Joe, at that time. I think maybe that helped you.
It's never settled, man. It is never settled.
It's never settled. It's never settled. And it was actually the losing of that woman, not the losing of that woman, but being single again after the fact, that propelled me to, it was funny. I remember, sitting in my new apartment after I'd separated from my first wife. I had my futon, I had my PC. This is 2001, 2000, something like that.
Yeah, like a bottle of Manischewitz.
Had my futon and a sleeping bag, and that was it. And I remember thinking to myself, and my TV, which is sitting on the floor, I remember seeing an MHR infomercial. And I thought to myself, I know it's not like that, but Jesus, it had to have improved since I had mine. And that's what set me on my journey to get fixed. And
did you say, was it because you saw that commercial or because you were missing a significant other or you were missing love or woman, whatever you want to call it?
I had just been put on my ass by being separated from my, this is separation from my wife. So right. I was on my ass emotionally, mentally, like I was, deepest of the deepest lows. And right. I realized I'm going to be single now. I gotta fix this shit on my head. I finally have to do something. And it was the MHR infomercial that kind of snapped me into it. It's like, this is my reality. I'm right. in my early 30s now. I'm back on the market, or I will be once I get through this funk. I can't do this again. This is ridiculous. And I thought, surely to God, it's improved somehow. And that's what started my journey to learn more. I finally, for the first time ever, I actually did real research. And even by today's standards of what I tell people to do, it wasn't enough. I just got lucky. In fact, I got real lucky because
really lucky.
I got real lucky.
Most people see you now and say, well, look what he went through. And he got out of it one way or another. you were in the yours is maybe a 1 in 1,000 story, because
Less.
other people
Less than that.
One in a million at that time.
1 in a million.
Yeah.
So when people look at you and say, well, look at where he came from. You know, if I have a bad problem with my transplant, even today, I can recover. That's not true. You were very lucky. You were in the right place. You did the right thing at the right time.
You can recover. You can recover if you make the right decisions, and if all the stars are aligned after you make the right decisions.
Right.
So Joe just kind of lucked out. He didn't really do the due diligence that he would suggest that consumers or patients today do. He just ran into the right person.
I ran into the right person, but after I ran into that person, I remember walking on my consultation. I thought to myself, hold on, put the brakes on. That guy just told me everything I wanted to hear. Like, we can do this, we can do this, we can do this. And this is a story I've told before, but I finally realized I need to dig deeper. And so that's when my alter ego, Joe Tronic, was born. When I first started going on the forums and started asking questions. Hey, I was just told this, about Dr. Wong, and about these, is this legit? And this is before people were sharing all their photos. This is before people, this was very, very early on in the online development of the hair restoration industry. No one was sharing their results as far as before. There was a few before and after, but the patients weren't doing it. It was the clinics. And finally, I got in touch I saw 3 patients in person, and the naturalness of the work, even back then, still rivals the naturalness of many of the top clinics out there today, because they were doing it right. And I saw it with my own eyes, and I realized this is the right place for me. And that's why I got lucky, because I could have gone anywhere else. I could have been in any other city, and my search would have been a lot longer, because back in 2001, 2002, there really weren't many clinics that were number one, able to do what they did for me, and number 2, able to do natural work in general. Very few doctors out there on a consistent basis.
And
that's how I lucked out.
Yeah, you were also lucky that the timing was that in your 30s, after on your futon over here in your apartment, picking yourself up from the bottom up, the technology, at least people like Dr. Wong, had come to know that. Because if you were 10 years earlier, you said you were 10 years older, you would have looked, when you're mid-30s, it would have been the 90s still. And that technology wouldn't have been there, and you would have done, right? Or wrong. Or you would have not been able to.
To be fair, the work I had, like when Dr. Wong was doing mini micrografting, which he didn't do it for very long, the work was still light years ahead of what I had just a few years, like in the early 90s. Like when Dr. Wong was doing it in 95, it was still a lot better than what I had without microscopes. So, it comes down to the doctor having a natural feel for what's aesthetically pleasing, what works, what's natural looking.
But do you think if Dr. Wong was back in 95 and you were a little bit older, time was just where your timing was a little bit off, and you were in your mid-30s and it was 95, that Dr. Wong would have done such a job like what you have now?
Oh, of course not, because microscopes make a big difference. Microscopes allow for the finer details to be seen. But I got to tell you, we're talking about mini micrografting versus follicular unit transplantation, which is being able to use microscopes to see the natural bundles as opposed to chopping up bigger bundles. Mini micrografting isn't inherently a bad procedure on its own. It means you can still get good looking singles. You can still get a natural result because it comes down to the angle and direction. It's just using microscopes allow for more refinement, but also for a better density, because you got smaller grafts can be placed closer together. That's the thing about it. And mini micrografting can still look good even today.
But in 95, my point is back in 95, since they weren't using the microscopes, if you would have been at that age in your mid-30s in 1995, and even with Dr. Wong, you wouldn't have had the appearance that you have now. You again were lucky, even with the misfortune you had for the first one, you were lucky that the timing was right with where you should have been. Because I'm thinking that in your mid-30s, be it you were, you know.
No, I mean, listen, I totally get your point. Yeah, I mean, it was timing, and it was the fact that the technology was certainly advanced to the point where he was lucky enough to find and just happened to run in to the right guys. But during that same time period, there was a lot of bad work being done.
Yeah.
So, you know, I mean, he could have made a left turn instead of a right turn. Right. He could have decided, you know what, this sounds too good to be true. I'm going to go with the guy who may be a little bit more conservative sounding, and then been totally fucked up. He just lucked out.
I'll go the guy that's not out of the country and down the street.
Right.
You know?
But look, man,
we're
going to call it a night. We've been on the air for 3 hours. I really always appreciate you calling in, Lewis.
Let me give you one last thing I want to tell people.
Yeah.
Because, Spencer, don't fall off your horse when it comes to, I remember you are saying to people, look, if something out there was working, especially these nutrition things, I'd know about it. And all the Nutrafol and all that stuff that I've been seeing, and you guys mentioned it tonight, that's, you know, people start using that and think they're going to get great results, and then they go away from using the stuff that might actually help them, in my opinion.
That can happen, yeah.
Yeah, stick to your guns. That, you know, these guys, these nutrient people, they're not going to find it. It might help, maybe, who knows what, but if you, not for bald, you know, male pattern baldness. Nutrition is not, you can eat well to get your nutrition. So a lot of these stuff.
I will say, listen, I definitely do stick to my guns, but, you know, there are ways in which you have to kind of present yourself on, you know, through the media, online, whatever it is. And the reality is, I am, you know, essentially giving people the information that I think they need to know. That, you know, there is no data that I'm able to see that any of these nutraceuticals actually have any long-term results. A lot of these products have been around for a very short period of time. You'd never know, though. Something could change. But right now, if it were me, and this is how or if it were a family member, I would say, you know what? Probably not the best choice.
Yeah. Do you guys remember that Smiley guy with the natural product for ED?
Oh yeah, sure, yeah,
of course.
You know, that guy made millions of dollars till they closed him down, because I know you were talking about, we've kind of gone back to, they started to bear down on these companies, and then now it's like you see, you know, the marketing and the wording and all this kind of stuff, and the laser, you know, this is a product that will work for you, and you don't have to go to transplant. It's all kind of going back to that kind of stuff. It looks like they've opened up a little bit, and people will push the envelope.
We are back to the dark ages until somebody's made an example of, and then everyone will you know, kind of go back into under their rocks for a while, and then a few years will pass, and it'll start all over again. That's why we just have to keep doing what we're doing. Listen, Lewis, thank you so much.
You guys are doing it great. Keep it up, guys. Have a great Friday. You guys on Friday, you got to busting yourselves and making the world better.
All right, man.
I like it.
I appreciate that. You take care.
Okay, guys.
All right, bye-bye.
Take care. Bye.
See ya.
Joe, you want to give out the websites?
Absolutely. Start with our French supporters and friends. We've got international-hairlossforum.com. It is a French-based hair restoration and hair loss forum with lots of clinics showing their results that they put out, and lots of patients sharing their experiences. Because it's, even though it's in French, with any modern browser, it is translated into the language of your choice. That's international-hairlossforum.com. Next up, we've got bellycapelli.forumfree.it. That is the Italian hair loss and hair restoration forum. Again, clinics sharing results, patients sharing experiences, lots of great information. They do support our message. Both of those websites, great friends of our program, and believe in our message and allow us to stream through their web property, as does the final, number 3, hairlossexperiences.com. Another great website, supports what we do. Great guy that is behind the scenes helping others that are in need of repair, just like he was, just like I was. Clinic sharing, patients sharing, check them out. That's hairlossexperiences.com.
Our website's Joe Tillman's personal website, hairtransplantmentor.com. Everything Joe Tillman. Learn all about his journey and why he's sitting in this chair today. It's pretty heavy. And the guy has a tremendous amount of knowledge. He's working with some really great IHRS accepted members that you can learn about. And remember, Joe has the same message that we have. That's why we're working together, or at least on this show. Surgery is a last resort. Take it from Joe. He wouldn't have had surgery if he knew what he would have had to go through.
I've said it many times.
Yeah. So our website for the show is thebaldtruth.com. That's thebaldtruth.com for archives of this broadcast. Also, again, go to Joe's YouTube page. He's got about 10,000 subscribers, very close. It's about to hit that mark. So go to youtube.com/hair transplant mentor and fucking subscribe. That's it. It's easy. You don't have to watch the show on Joe's page, but at least you know we're live. And if you're listening to us on iHeart or iTunes or any place else live right now, you could always watch us on your phone through The Bald Truth and, of course, directly on Joe Tillman's page. Once you subscribe, ring that bell so that you can get notifications. And also, guys who are in the chat room right now, like the program, please. It's not that hard. The American Hair Loss Association, AmericanHairLoss.org. If you're considering surgical hair restoration, check out the International Alliance of Hair Restoration Surgeons. That is IAHRS.org. And if you want to interact with other hair loss sufferers, we do have a message forum, baldtruthtalk.com. You can check it out. My mantra is stay off the forums, but it is a great place to get some insight, kind of see what's going on, keep your finger on the pulse of what's happening in the field, and realize, though, that most of the people on there are anonymous, and that goes with any forum. So take what you read on message forums, especially when it comes to something as serious as this, either ingesting medications, putting something on your scalp, or having surgery. Take anonymous users' points of view with a grain of salt and do your due diligence and your own research. That is it. Until next time, be strong, God bless, and thank you so much for listening. Good night.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the program, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you. Good night.
You're a smart motherfucker, that's right. Sir, one more outburst, I will strangle you with my microphone wire. You understand me?